3, we have a bifurcated agenda today. Our first agenda has to do with issues related to health. The second agenda, human services. We do have a vote-only calendar, and the items on it are to be found on pages 2 through 5 of the agenda. Seven items in total, and without objection from the committee, we will recommend approval of our vote-only items. For our discussion issues, we're going to start with the Emergency Medical Services Authority. If you could please come join us. And this is to be found on page 6. We've got a full house. There you go.
Good afternoon, Mr. Chairman, members. I'm Jeff Rubin, Chief of Disaster Medical Services for the Emergency Medical Services Authority, here today for Dr. Stephen Thurrott, our Director, and with me is Rick Trussell, our Administrative Chief.
Welcome.
The item in front of you is to fund the Emergency Medical Services Authority for the pharmaceutical cash for our 3 mobile field hospitals that were authorized by the legislature and the governor 2 years ago. The issue at hand is to provide an ongoing cache of pharmaceuticals that are ready to go when the hospitals deploy in a disaster, be it a natural disaster, technological disaster, or a human-caused terrorist attack. It's critical to maintain those pharmaceuticals for the overall readiness of the hospitals, and we're here today asking that a permanent augmentation of the general fund for $448,000 be included in the ongoing budget process.
Thank you, Mr. Rubin. Do we have any public comment on this item? Doesn't look like we do. We're going to be holding this item open and taking no action today. And that's all we need from you.
All right, great.
Thank you very much.
Thank you.
And then we'll be moving on to page 7, Department of Public Health. New Health-Associated Infection Surveillance, Prevention, and Control Program. Ms. Billingsley, welcome.
Welcome. Thank you very much for having us here today.
I know this is an issue of particular importance to Senator Ahlquist, having authored some of the legislation you're going to be telling us about.
Yes. With your agreement, I'll go ahead and cover the 3 questions that were presented to us in the agenda.
Please.
And the first is to provide a brief summary of the proposal and the request for the positions. This proposal would implement the mandates of Senate Bill 739, which was authored by Speer in 2006, 1058 by Senator Elaine Ahlquist, and 158 authored in 2008 by Senator Flores. So we have combined these 3 bills into one budget proposal, which we believe is a very effective way of addressing this. These mandates include the development of a program for surveillance, prevention, and control of healthcare-associated infections, implementing public reporting of a number of healthcare-associated infections, implementing public reporting of a number of healthcare-associated infections from all 450 California acute care hospitals, appointing and continuing the advisory committee to make recommendations for reporting and the prevention of HAIs, and reimbursing members for their travel expenses, revising regulations to be consistent with current standards for HAI prevention, and providing information on HAI to the public. The proposal includes 11 positions, the core staff for the reporting of infections to the department, analyzing this large amount of data and making it available in a useful form to the public. What core components of the program will be implemented first as a priority? The first priority is to implement the reporting of HAI to the department. In order to implement the reporting mandates, the program must develop and publish directives and guidelines for reporting, provide consultation and education to hospitals in the methodology for the collection of data to be reported, and develop an electronic database to house, receive, and analyze the data. The next question, which is one that the Assembly asked as well, and that is that the Federal American Recovery Reinvestment Act provides $50 million in federal grants for states to address hospital-acquired infections. Will California be applying for some of these federal grant funds? And the answer to that, of course, immediately is yes. We will go ahead and apply for a portion of these funds. Grants have an estimated maximum of $1.1 million, less than the amount of the finance letter. This is a competitive grant, not a provision of funding. The deadline for submitting the grant application is June 26th, and an announcement of award will be made August 30th. The grant guidance states that recipients will need to assure this funding supplements an existing program and does not supplement existing efforts. The grant specifies activities such as developing and implementing collaborative, multi-center, evidence-based HAI prevention initiatives among acute care hospitals within the state that are beyond the scope of this finance letter. Other grant activities beyond the scope of the finance letter include validating or reporting data for accuracy and a laboratory component to conduct systematic confirmation testing of selected pathogens associated with reported HAIs as a means to validate and supplement local HAI data and to detect emerging antimicrobial resistance. In addition, as I mentioned, there was a $50 million grant. $10 million of that has already been allocated through the CMS program to survey and certification, which actually supports is part of our grant for the licensing and certification program. So of the $50 million, $10 million will be given to all of the states for the oversight and review of ambulatory surgery centers. California has also already been informed by CMS that we will be given $1 million to do that particular work, which we also feel is very important, not in some way related to the work that has to do with HAIs, but takes a different pathway.
Ms. Billingsley, is the no supplanting language to which you earlier referred the same as a maintenance of effort?
Well, basically what I'm saying here is that they fully expect you to have an HAI program, that this doesn't supplement the fact that you can use these funds to create a program. And I think that we've done an excellent job of focusing our efforts on what we consider to be incredibly important, which is the collection of the data from the hospitals and then reporting that information back out to the public, because we believe that will drive change and improvement efforts. The grant, on the other hand, would help with collaboratives and other activities that are currently not covered under the finance letter.
I was really taken aback by some of the figures in our analysis here, that in California's, just in the 450 general acute care hospitals, an estimated 240,000 infections, 13,500 deaths, and $3.1 billion in excess health care costs annually. So these are dollars well spent.
Yes, they are. And I think that's one of the efforts that I have been working on going forward, is to conduct some regional sessions throughout California to educate some of the CEOs of hospitals about the cost savings. Not only is it one of the most important quality and clinical issues that we need to address, but I think it will help us with health reform in the future by putting our dollars into this area.
Thank you. As we have the author of SB 1058 with us, I wonder if Senator Alquist has any comment.
Thank you, Chair Leno. Just to say, obviously all these pieces of legislation are really important, and I do believe that the department understands the importance of implementing, and certainly I, along with Senator Leno, will be really, seeing how this is done.
Absolutely.
And knowing that you will do a good job. Thank you.
Well, we certainly intend to do an excellent job. We've been doing some of this work ourselves, consulting in addition to our other jobs, because we believe that this is just very important work for all of us.
Thank you.
Thank you. I know we have some very eager public comment.
Beth Capel, wearing my Service Employees International Union hat, here to support the request of the Department of Finance to implement Senator Alquist's earlier legislation. And as the chair noted, substantial savings to be had from avoidable medical errors. One of the most frustrating things in healthcare is how much money we spend on unnecessary or unsafe care, and to the extent that we can get rid of that, it's a good thing for the larger healthcare system and for the Medi-Cal program.
Thank you, Ms. Capel. Any other public comment? If not, I'm going to move that we adopt the finance letter.
Well, thank you. We're thrilled.
And without any objection, that will be the action of the committee.
Thank you very
Thank
much.
you. Moving on to page 10 is our lead-related construction program funding. Department of Public Health.
Hi.
Welcome.
This program was established in 1993.
Could you introduce yourself?
I'm sorry, I'm Linda Rudolph. I'm a Deputy Director in the Center for Chronic Disease Prevention and Health Promotion.
Thank you, Ms. Rudolph.
This lead-related construction program was established in 1993, and its intent was really to protect workers and children and family from lead exposure during remediation of lead hazards in construction activities in public housing and other residential housing. And the program operates on a fee basis, but the fees are deposited into the general fund rather than into a special fund. And last year, the general fund dollars for this program were eliminated. So we've maintained a baseline program using some federal funds that we may or may not be able to continue. Maintenance of this program is required by the federal government for the receipt of about $22 million a year in HUD money that we get. And we're proposing a mechanism to maintain the program as a fee-funded program at its prior level. Do you want to talk about how?
Okay. Good afternoon, Mr. Chairman. I'm Jose Ortiz. I'm the admin deputy for the Department of Public Health.
Welcome, Mr. Ortiz.
As technical assistants, we would note that while we support the administration's proposal, we have a large number of special funds within the department. Each of them require a certain amount of management and accountability. And so there's workload associated with that. That typically is about half of PY to support. We would note also that this would appear to have a negative impact to the general fund revenues because of the fact that the money has been deposited there in the past. Theoretically, it should be a wash. As to the direct transfer of the money itself, we would just cite that it does raise, and it's noted in the agenda, there may be a tax issue, there may be a challenge. It's not something that we can predict or control on the tax versus fee issue. We would also note that if there is borrowing that needs to ultimately be done in order to support the establishment of the new fund and the cost that it would have, there may be some borrowing that's necessary. And an outright transfer of the money, It's just a matter of how you interpret the purposes for which the fund was established, and a reasonable person can choose to agree or disagree whether it's within the intent. And that's it as far as what the fund was established for in our particular testimony.
So the agenda points out that the occupational lead poisoning prevention account has about 1.7 million balance currently. So the 500,000 we could take from it to put into this new fund would then save the 500,000 in the general fund.
That would be a correct assessment.
And do you have a strong opinion as to whether this should be a loan or otherwise?
I think that to avoid any possibility of a legal challenge, it's always safer to go with the loan. But we could provide a legal interpretation since I'm not an attorney myself.
We'll take your counsel.
Okay.
Counselor?
Thank you.
And then establishing this new fund so that there'll be no question in the future as to whether it's tax or fee.
Okay, very good.
All right. Any public comment on item number 2? If not, the motion then is to appropriate the $500,000 from the occupational lead poisoning prevention account, one time only, and to establish the special fund to collect the fees under the lead-related construction program fund.
Okay. Thank you very much.
Without objection. Thank you. Department of Healthcare Services. Page 12. Medi-Cal eligibility verification. Welcome back.
Thank you. Good afternoon, Senator Leno, Senator Alquist. Toby Douglas, Department of Healthcare Services. So the first item is the Medi-Cal eligibility verification. As discussed at the last subcommittee hearing, the department is proposing to implement an electronic asset verification with financial institutions that is required under federal law. This will be for age-blind and disabled populations. At the hearing, both of you as well as stakeholders raised concerns about the trailer bill language. We have been working since then with the stakeholders to refine the language and have made several changes, including, first off, making it clear that we will ensure the most flexibility possible under federal law, that we are going to have a process to work with counties and stakeholders on the development of the system, as well as ensure there are privacy protections throughout and make clear in the statute the role of the financial institutions. So we feel very good about the process, working with the stakeholders, making sure that we had their input, and we'll be moving forward with that trailer bill if you approve.
So we'll no longer require asset verification and some of the other things that were of concern to us before.
Well, it will be permissible. We will be able to, again, as much flexibility on federal law, so we did add may, that
Right.
it would be permissive to the extent possible.
Very good. And then, as you've probably noted in the agenda, the one concern that we have is with regard to a time period to be set
And we are...
for when the regulations would be developed.
Yeah, and the idea of 3 years, we are supportive of Ms. Van Maren's recommendation, and that would be fine with us.
Very good. I think someone's in the wrong committee hearing. But if it's for me, I'm busy. So with that one change, our motion, well, first of all, we want to hear from public comment, of course.
Mr. Chair and Senator Alquist, Elizabeth Landsberg with the Western Center on Law and Poverty. As noted, Western Center has had numerous conversations with the department staff about the trailer bill language. They've been very responsive and very helpful. We do feel much more comfortable with this current language going forward. We have no further issues. We appreciate the approach of the department that, yes, this is a federally required program, but that we'll do it with an eye to not harming beneficiaries. So thank you.
Thank you, and thank you for your help in the process.
Beth Capel on behalf of Health Access California to concur with Western Center.
Thank you, Ms. Capel.
Frank Mecca with the County Welfare Director is also in concurrence with the prior speakers. We support the language and appreciate the department's work.
Thank you, Mr. Mecca. You've wowed everybody, Mr. Douglas.
It's Ms. Abel over here who deserves the credit.
And you're gracious, too. So thank you. Job well done. And then the motion of the committee would be, with that one change of the time frame of 3 years to set the regulations, that we will accept the trailer bill language as a placeholder without objection. And then the second item on page 14, trailer bill language to establish maximum allowable ingredient costs for generic drugs dispensed by pharmacists. I have to say, as someone somewhat new to this whole issue, would it be best to just start from scratch? This is the most confusing.
Some people say that about the whole medical program, too. So as an overview, as we discussed last time, that our pharmacy pricing is extremely complicated, and one area where it has been complicated and people have pointed out that it doesn't seem to be rational is around our generic pricing. So what this proposal really focuses on is trying to create a better pricing structure around generics so that we can approve generic drugs whenever possible. And we proposed trailer bill language again, been working with stakeholders on refining it, and Pilar Williams will talk a little bit about that.
Thank you.
Yes, hi, Pilar Williams, Chief of Pharmacy, Department of Healthcare Services. There are a couple of, we received comments from stakeholders, and we had incorporated some of those comments into our trailer bill. One of the issues that the stakeholders had was a little bit of confusion as to what we meant by hiring a vendor to help us set the MAC prices. So we clarified the language so it was clear to what we meant by hiring a vendor to help us with that. It was for the purpose of surveying prices to establish the drug prices for the generic drugs. Another concern that the stakeholders had was with the number of drugs that would be available before we set the MAC. Our original language didn't specify a number of drugs. We were okay with the 3 generic equivalent drugs that they have proposed, so we were okay with that. In addition to that, there was a concern about the lack of clarity in the language about how we would establish the maximum acquisition cost. So we clarified that language to say we would use a weighted average to set those prices that would be weighted, meaning we would take into consideration the use of those drugs in the medical program to set the average prices. So I think those were the 3 major concerns. There was also a suggestion, which we accepted, to let stakeholders in the future come to the department and tell us of concerns about the prices that we were setting, not exactly matching what was the available prices in the market. So we had a language there now that allows them to do so.
Thank you.
Does that make it a lot more clear for you?
Oh, crystal clear, yeah. All my questions have been answered. Do we have any public comment?
Peter Kellison on behalf of Walgreens. We continue to have concerns with this language. We have been working with the department. We'll continue to do so. Very briefly, the concern is that from the pharmacy perspective, there's 2 forms of payment to pharmacies for every prescription drug. There's the cost of the product, which in this case is the MAC, the maximum allowable ingredient cost, and then there's also a dispensing fee. Because the pharmacy is on the receiving end of 2 streams of reimbursement, the issue that they wish to focus on is the total compensation when they dispense a prescription drug, not just one part of it. Because what's happening here potentially is that the ingredient cost is getting reduced without there being any sort of addressing on the dispensing fee side. We do appreciate the department's responsiveness in clarifying parts of the language. However, with that clarity comes additional concerns about the definitions, how things will be established. We do have concerns. We will continue to work on it, and that's where we are.
Thank you, Mr. Kellison.
Jennifer Snyder on behalf of the National Association of Chain Drug Stores. Echo the comments of Peter Kellison. We appreciate the department's need to come up with a pricing structure for generics. The concern is now looking at more details in the language. We still need to evaluate whether or not we agree that it's a fair pricing structure, and so would like to respond a little bit more with some more detailed language, and we'll do so as soon as we can.
Appreciate that.
Trent Smith on behalf of Rite Aid Pharmacies. Appreciate the committee is going to adopt this as placeholder language because, as you've heard, I think some more discussions with the department are necessary.
Thank you, Mr. Smith.
Thank you. Melissa Cortez Roth on behalf of the California Workers' Compensation Pharmacy Alliance. Unfortunately, workers' comp rates are tied to Medi-Cal, so we do also have some concerns with the language. We have been working with the department and will continue to do so. Thank you.
Thank you.
Mr. Chairman, members, Tom Bone on behalf of the CVS Caremark pharmacies, feeling that we were in the same position as the other witnesses. Thank you.
Thank you. Any response?
We definitely are willing to continue to work with the associations. We feel that we've come as far as we can on the language. I think this really fundamentally comes down to there will be a fiscal impact. This is both about readjusting the pricing structure, but there are savings that's associated with it. And unfortunately, we are in a tough fiscal environment.
So in a very, very simple overview of a very complex subject, your idea being that as these pharmacies move into dispensing of ever greater quantities of generics, that there will be additional compensation to make up for whatever.
No, at this point there is no additional compensation. It would be savings. It would be both allowing them to dispense generics that are cheaper for them to buy,
right.
Savings to the state. But there might be overall, for some pharmacies, they might be losing a little bit more money than they would today because there's savings to the state.
And when you say some, which can you even envision which may benefit more with this scheme as without? You say some pharmacies will.
Yeah, I couldn't. I'm sorry, I don't know which ones, but I think that's the main concern moving forward.
All right. So there will be ongoing conversations. And without objection, we'll accept the revised trade bill language as placeholder. Very good.
Next item is mental health supplemental payment program that, as we discussed last time we met, this trailer bill is really focused on maximizing federal funding for county mental health programs. Right now, we pay through both our mental health program, especially mental health, as well as through the fee-for-service system and Department of Healthcare Services, a schedule of payments, but the costs at the county level could be above that schedule, and we're not maximizing federal funding above the payments that we provide. What this does is ensure that we're maximizing federal funding and bring more dollars to the counties. We have met with both the County Mental Health, the Directors Association, some of their county representatives, with the provider associations about the language. We have made some technical changes to reflect more accurately the types of mental health plans that could do the certified public expenditures, the role of contracted providers and their ability to be part of this. And we believe now that the language definitely reflects technically the proposal. There is still concern, and I'll be honest, there's concern between the County Mental Health Directors Association, their counties, as well as the provider associations, on the role of providers once this is implemented. Meaning, will counties be implementing this supplemental program just for their county facilities and not for their contracted providers? At this point, the language is permissive that counties can contract with provider associations and allow those rates to be above the schedule of maximum allowance payments that the state sets and be able to receive extra federal funding, but it's not mandatory. There's a difference of opinion that continues to be on the table. Both departments feel that's something that the counties and the providers need to work out and will not be changing the language at this point.
Thank you. We have some public comment.
Thank you very much. Good afternoon. Don Kingdon, Deputy Director, California Mental Health Directors Association. We want to testify in strong support for both the state plan amendment and the trailer bill language, and also would like to commend the departments for their collaborative work with our counties. This really could be the future of California and get us out of the hole that I think we all feel we're in today. So very strongly in support and very happy the departments were collaborative in this case.
Thank you, sir. Any other opinions to be shared?
Rusty Seelix for the California Council of Community Mental Health Agencies, and we can agree with virtually everything that's previously been said, but we do need an amendment to this. As currently written, there's no obligation for the counties to include the privately operated services to the same extent that they include their directly operated services, and we don't have any assurances from the counties they will do so. The fact of the matter is what you're dealing with is providers who will lose money on every single unit of service unless there's some reimbursement. This proposal provides the opportunity to have 61% of that amount paid for with federal funds, and that can provide the relief that can allow the providers to not have to do what they're doing now, which is dipping into the reserves. Because the state also did not provide a cost of living adjustment to the maximum rate, for 3 years now, this is starting to hit a number of providers who are saying this is a life and death issue. If we don't get assurances that we will be included to the same extent as county operated, we could go out of business. And it's that serious of an issue that we think this is one of those rare instances where the legislature, rather than leaving things to local matters, should provide that guarantee. These issues don't come up very often, but I just handed out the correct language we have and some additional history that the state has often had to intervene, and the Department of Mental Health more often than the legislature, to make sure that counties treat their private providers fairly. These are not typical businesses. They are virtually 100%. All they do is provide services that are county funded. So without their county contracts, they're out of business anyway. And the language we propose would say if you don't think they're worth having and you don't want to contract with them, you don't have to. And if you don't think their costs are legitimate, you don't have to provide this. But if you're going to budget, and this would only be starting in the 2010-11 year, for your own costs above the maximum rate, we think it's only fair that you should be required to include the private providers that you choose to contract with to the same extent. Now, we also understand there's a lot going on, and county-state relationships are difficult right now, and we're happy to have more conversation on this and let it stay open. But to have this go forward with the current language without those kinds of protections, we fear is going to severely, harm some of the most important nonprofit agencies that provide services in our state. Thank you.
Thank you, Mr. Seelix. Anyone else?
Hi, Nased Short with the California Alliance of Child and Family Services. We also work with private nonprofit organizations. It's always tough following Rusty because he always captures all the points that we were going to share. We really appreciate Mr. Douglas and Healthcare Service in kind of calling a meeting together, but we're hopeful that this can remain open and we can engage Healthcare Services a bit more. We have proposed an amendment. We think it's critical to this. We are willing to have some conversations and talk about some changes and caveats and caps to our amendment if it makes the counties or Healthcare Services feel more comfortable. We haven't had that opportunity, so we're going to urge you to keep this item open, give us some more time to talk through the issues. Thank you.
Ms. Short. Mental Health Services have anything to
Thank you,
add to
Senator.
this?
Mark Heilman, Department of Mental Health Services. I know that one of the questions in the agenda was how the departments would work together to implement the provisions of the trailer bill language. I just want to reiterate Mr. Douglas's comments that we are committed to working with the counties to make sure that this is a smooth and efficient implementation.
And any thought you can offer relative to Mr. Seelix's comments?
Yes, I would again echo Mr. Douglas's comments that we see this as a county provider contract issue, and that it is not mandatory that all counties would provide it, but it is permissive, and that would be our position on it.
Okay. Just to try one more time, is there anything illogical about his point that if counties are going to be providing this augmented rate to one, it should be for all?
There's nothing illogical about his position, but I guess our position would be...
It's just not your territory.
Well, it's not our territory, number one, and number two, we would want to make sure that it would work for everyone if we were to mandate it, and we're not sure that it would work for all counties.
Okay. Very good. Clearly, yet a debatable issue, so rather than take any formal action today, I think we're going to hold this open. So our next is item number 4, the Genetic Handicapped Persons Program.
Good afternoon, Mr. Chair, Senator Alquist. I'm Luis Rico. I'm the chief of the Systems of Care Division, and I'd like to provide you with some information about the GHPP program, and I will be brief. The GHPP program is intended for persons with genetically handicapping conditions and individuals who have diseases such as cystic fibrosis, sickle cell disease, Huntington's disease, and hemophilia are covered under this program. These are just a few of the diseases. There are many more. GHPP provides comprehensive health care services, including diagnostic services, medical services, surgical, pharmaceutical, and, of course, hospital inpatient services. Individuals who are eligible for the program must first have one of the qualifying medical conditions. They must be a resident of the state of California and demonstrate that. And although there are no specific financial limitations, individuals with a family income of greater than at $40,000 annually or greater are assessed an annual fee. Individuals who are at 200% of the FPL or below that poverty level are not assessed a fee. Today, there are approximately 1,700 individuals who are enrolled in the program. Of that number, there are approximately 415 who are individuals who have been diagnosed with hemophilia. The significance of that number is that 90% of the expenditures in the GHPP program are attributable to individuals who are diagnosed with hemophilia. Hemophilia is a very complex medical condition. It often results in comorbidities and complicates treatment for the individual. A very few episodes of bleeding can dramatically change the individual's cost in any given year. That in turn can change, of course, the costs for the payers of those services. In this case, it's the State General Fund, Department of Healthcare Services. The vast majority of the individuals in the program are adults who in their early years of treatment received a blood factor that was biologically based as opposed to a factor that is now not biologically based, which in turn unfortunately caused a lot of these individuals to also contract hepatitis, HIV, and AIDS, which just simply complicates the disease. As individuals age, their condition progressively becomes worse. One of the characteristics of the disease is that there is bleeding in the joints of the body, the elbows, the knees, and the ankles. And, of course, without treatment over a period of time, these conditions can damage the cartilage and damage the joints of the individual, which in turn will require significant invasive surgeries. An example, of course, was last year. There were a number of individuals who coincidentally required surgery. And, of course, the significance of this, too, is that prior to surgery, there's an influx of blood factor that's necessary prior to surgery. It's required during surgery, post-surgery, in recovery, and then again, that same regimen is followed for any physical therapy that's required. So that the cost of treatment for this population is very high. Last year also we did see an increase in the number of individuals who are eligible for the program, and again we saw an increase this year slightly of that population as well. The department has proposed trailer bill language.
I was going to ask if you could get that.
To increase the fees of the program. Today, there are individuals paid less than probably under 1% of their family income, gross family income. Under the proposal, we would propose that individuals at 200% of the February poverty level or below will be assessed no fee. Individuals at 200% to 299%, 1.5%, and individuals at 300% and above would be assessed at 3% of their adjusted gross annual income. And just to be noted that fee increases have not occurred since the inception of the fees in 1992. This would be the first occurrence. The second trailer bill language is the crowd out and the premium payments trailer bill language. Under this proposal, the department is suggesting TBL to encourage individuals that have employer-sponsored health coverage to continue that coverage. We are also proposing that the department be granted authority to pay for premium payments on behalf of individuals who may have lost their other health coverage. The proposal is projected a savings of approximately $593,000 a year.
And that's an idea that we'd be borrowing from other programs that seems to be working.
That's correct, our HIP program. Under the advice of stakeholders and legislative consultants, we have made some changes to the trailer bill language to include provisions to include a stakeholder process in any actions that may require application changes, modifications. We'll go ahead and do that and make sure we get that input. We've included provisions to adopt regulations in an 18-month period. We've amended, on the suggestion of stakeholders, notification language that was and does require an individual who loses other health coverage to notify the department in 45 days. That was previously 15 days. And the other modification includes a greater latitude given to the director of the department to waive certain eligibility requirements or periods of waiting periods. That's it.
Very good. Any public comment? So we're going to, without objection, adopt the revised trailer bill language with the understanding that you will keep us updated on any changes in the collection of the drug rebates.
Absolutely. Not a problem.
All right. Without objection. Thank you, Mr. Rico. And then the last item here is number 5, California Children's Services Program.
The California Children's Services Program serves the most vulnerable children in the state with really complex medical conditions. In our CCS program, we have about 175,000 very vulnerable children. Over the last several years, and this has been going on for several years, we have encountered difficulties with the program. And with the fiscal challenges in the last year, it has gotten even more difficult to administer the program. Last year, we set a hard cap on the allocations to counties for the administration of the CCS program, the money that they use to do the prior authorization, the eligibility, the case management. Because of the fiscal constraints, we had to cap that. This has meant that we have had to work with counties over the last year on looking at how do they live within these capped allocations. What are some types of efficiencies we can develop through the process, from eligibility to the authorization, to ensure that they can use the dollars and not have to lay off staff and not to create even more any barriers to receiving the services for these children. Mr. Rico will briefly talk about that. The other side of it that's been an ongoing discussion has been with our other stakeholders, providers, hospitals, as well as physicians around our ability to ensure timely discharge of children from the hospital setting. What are ways that we can make sure that they're receiving home health services, medical supplies, durable medical equipment in a timely fashion so that they can move from where we all want them from out of an inpatient setting to back into the community. Briefly, Mr. Rico will talk about a few of those changes.
Right. Just briefly, over the last 12 months, we have been working with the county representatives in a series of meetings that we've had to discuss an allocation methodology moving forward. We talked about this year's allocation, looked at some of the experiences and the consequences of the methodology this year. Looking at now moving forward for 9-10, we've engaged the counties in that area. And beyond that, looking at what we can do with allocations in 2010 and 11, and looking at and considering any methodologies that the counties might have. We're very willing to do that. We understand their situation, and we want to work with them on that. In addition to that, we've held a series of meetings also to discuss various efficiencies that might be considered in the program to ease some of the burden on the counties, both in the administrative area and in the medical area. And we continue with those discussions now, and we will continue that throughout probably the next several months.
What is the implementation timeline?
Pardon me? The
timeline?
Well, some of the implementation has happened immediately. For example, one of the changes they wanted was to be able to certify their public expenditures and draw down additional federal funding that was above the capped allocation. So we're setting a process in place so that they can receive extra federal dollars that are based on, similar to what we talked about with the mental health side, to be able to use their county costs to draw down federal funds. So that's implemented, and they'll be able to get additional federal funds based on that certification. Any of the efficiencies, the TAR changes?
Yeah, but one of the other things that we've done with the counties is to actually change our system in tracking of invoicing on the counties to ensure that we will process invoices quickly to ensure that we draw down as much federal funds as possible and not leave fiscal dollars in this year carried over for next year. So we've tried to do that. Some of the efficiencies that we've looked at include changes in the system, the CMS net system that will permit, for example, access to various county medical records for the CCS population through the state that will make things more efficient for the counties. We've instituted some changes in the way that county or durable medical equipment providers can actually invoice the department in doing more of a not capped, but a multi-treatment authorization or service authorization request.
And with regard to Los Angeles and the database?
Los Angeles is scheduled to be converted late this fall. October is the date. We're on schedule with that, and we anticipate that that will happen.
And that will be the last. Sacramento we did last year, which got us almost there. But with LA on, it will be ensure that the whole state is on one system.
Has there been some many-year delay with Los Angeles?
It has taken a lot longer, jointly, both state as well as the county decisions on trying to get, part of it is getting the county to move over because they had some unique case management systems already in place. So how did we balance making sure that they have what they had in place in their current system with moving to CMS Net, and that took longer, as well as just challenges at the state.
So it's now imminent.
It is.
Right.
And we'll be very happy when LA County has been converted, and that will include all of the counties in the state.
Thank you, Mr. Rico. I think we have some public comment.
Senators Judith Riggle with the County Health Executives Association. My members direct local health departments, and we do administer the CCS program at the county level on behalf of the state. As was indicated by the department, that includes determination of financial eligibility for children referred to the CCS-only program, medical eligibility diagnosis to determine if a child has a medically eligible disease for CCS, and then once those children are in the program, we are responsible for reviewing and authorizing all physician and hospital services. In the past, counties submitted budgets to the state for all of these functions based on the state-established staffing standards in each individual county's caseload. We have 3 caseloads, so there's some complexity there. Those were submitted to the state. There was back and forth. Once those were approved, then counties could claim up to that budget. So even though the legislature rejected the 10% reduction to county admin last year, the change in methodology, the capped methodology this year actually did result in an overall reduction to counties of 17% when compared to 07-08 approved budgets. That's not even taking into consideration 08 and 09 would have been. And because of the struggles with coming up with an equitable formula, which we're not quite there yet, those variations range from 2% reduction to 58% reduction. A lot of that had to do with different vacancies. So it's both the overall nature of the reduction and the inequity that we continue to struggle with, and we are appreciative of the department working with us on formulas. Unfortunately, it looks like it's going to be 10, 11 before we're at the kind of formula we need to at least get some equitably based formula that really takes into consideration all the functions we need to do and each individual county's caseload. The other thing is, then we have been in conversations indicated on efficiencies. I think our struggle is it really is a pretty significant cut, and so we've kind of picked the low-hanging fruit on efficiencies, so we continue to struggle. And the reality is that we have seen staffing reductions at the county. So far, they've been mostly elimination of vacancies, but we expect going forward to see more and more actual layoffs in the programs, particularly those counties that were hardest hit. We're very concerned about the impact that'll have on our ability to provide timely eligibility determination and timely authorizations. So we know that the state is in a dire fiscal situation, but we do think because it's such a vulnerable population that we need to look at how we get in line the functions that counties are expected to do and the funding, how we account for those three separate capped populations and deal with the equity issue among funding across counties. And we appreciate your staff's time with us on this, and we do support the proposed budget bill language.
Thank you, Ms. Rigo.
Nicole Wertelman on behalf of the City and County of San Francisco. We also have concerns with the new funding methodology, and it has resulted in a 25% cut to our current year budget, which is about $1.36 million, as well as 25 full-time staff positions. We also support the suggestions of the consultant.
Thank you.
Kelly Brooks on behalf of the California State Association of Counties. I concur with my colleagues' remarks, and we're also supportive of the budget bill language. Thank you.
Thank you.
Diana Dooley, the California Children's Hospital Association. We also support the language and appreciate the direction. We are working with the staff on stakeholder meetings, and we'll be working very closely with them to resolve these problems for the reasons that you've already heard. Thank you.
Thank you.
Hi, Erin Amber-Givens on behalf of the Children's Specialty Care Coalition, which represents the physicians who take care of children in this program. And if the committee will indulge me, I would appreciate the chair and Senator Alquist just a little history on the program. When this program started, it continued through the Great Depression and basically helped kids who were combating polio. So no matter what the status or situation of families during those hard economic times, California has had a long-standing commitment to making sure that no matter what your circumstances, children don't have to die from these treatable conditions. So that has been the ongoing commitment and history of California with this program. And we hope that the administration will certainly continue with that commitment. The legislature, on a bipartisan basis, has had a long-standing support for this program. Last year rejected proposed cuts that would result in making it more difficult for children to get into the program. So having said that, I do have a couple of questions in terms of what happens with these capped allocations when the money runs out. These kids can't go on waiting lists. That's a life-threatening situation for these kids. And we need to get some consistency among the different programs. For example, with Healthy Families, there is a process that has been put in place to deal with the economic downturn with establishing waiting lists and disenrollments. And within that, they do have a triage system to protect kids with CCS conditions so that they aren't left without coverage and without health care. So what happens with the capped allocation, and how is that coordinated with protecting kids and healthy families and making sure they don't lose their coverage? So finally, just some pie-in-the-sky ideas. We're hoping that some of the economic stimulus funds somehow could be used to help patch things together through these hard times, even if it's health IT funding that could be used maybe to improve the CMS net system in some way for more efficiencies. And finally, maybe the administration could request more additional Title V funds. CCS is the designated state agency for federal Title V funds for children with special health care needs. And if at some point there is additional federal help, maybe that can be something we can look for. We are very pleased and happy to participate in the stakeholder process, and we'll do all that we can to keep these services available for kids. Thanks.
Thank you, Ms. Auberg-Givens. Any response?
The only response, just to make it clear, these are capped allocations around the administration at the county level. Children continue to receive the services, and providers will be paid for the services. There is nothing that puts on waiting lists that they can't receive the services. It might slow down the administration, the authorization, and eligibility, but it has not changed our funding commitment to the program. I will be on the state-only program, the county program. There are concerns by counties who fund a piece of the state-only, which makes up about 12% of the total caseload, that they can't continue to support paying their share for the services. But we are not stopping the authorization of services and the payments.
Okay. Thank you for your assistance today. Without objection, the action of the committee will be to accept the budget bill language with reference to the need for the work group. Thank you. And that concludes our first agenda for the day. Thank you. So we're going to move right on to part 2 of our agenda, which is human services. We have a number of vote-only issues to be found on pages 4 through the top of page 12. And without any objection from the committee, we will approve the recommendations for the vote-only issues. Hello. Oh, thank you. Thank you. Good. Of our discussion issues, first we have the Department of Child Support Services. And the first issue is the update on federal performance measures. This is just an informational item, so no action will be taken today. Gentlemen, welcome.
Good afternoon. Excuse me. Good afternoon, Senator Leno and member of the committee. My name's Jan Sterla.
You may want to hit that button.
I'm relatively new.
I want to hit the button.
Oh, excuse me.
There you go.
Senator Leno.
Yes.
And member of the committee. My name is Jan Sterla. I'm the director of the Department of Child Support Services. I am relatively new to the department, having joined them on January 20th of this year. And I'm pleased to present our budget today to the subcommittee. While I'm new to the state, I am not new to the child support program. I come to the department after 17 years with the Orange County Department of Child Support Services, with the last 10 as the director of that department. I'd like to touch on some key areas that impact or will impact our budget, and I'll be brief since I think some of them are items that we will be discussing during the agenda today. First of all, the CSAS project. This is the statewide child support automation system. We received system certification of that system in June of 2008. What that did effectively was stop approximately $200 million in annual penalties that the state was paying out of the general fund, and it also resulted in a $193 million refund to the state general fund for penalties paid in the prior fiscal year. This system provides us with new opportunities to do business as a statewide system. It also relieved us from the statewide spending cap and now we are permitted to spend money on maintenance and operation of the system.
Mr. Sterling, just to refocus, we're going to get to that in the next item. So if we could concentrate on the child support caseloads as indicated in the first question.
Sure. Let me get to that.
Okay. And the state's performance on the 5 federal measures.
Yes. The state, first of all, the statewide caseload has declined approximately 1.8% since federal fiscal year 2007. That is the overall decrease. Most of the large and very large counties have actually experienced increases in the statewide caseload. To talk about performance measures, California does very well in the statewide paternity establishment. We are well above the 100% mark in that statewide. We do better than average in the establishment of court orders. We are below average, but we have been improving each and every year in both collections on current support as well as collections on arrears. Our big struggle with performance measures is in the cost effectiveness area, and this is certainly the area that the department must concentrate on and make a specific priority going forward.
Can you identify any of the factors that might lead us to this situation?
As far as the cost effectiveness, Senator?
Right.
We've been spending certainly a great deal of our budget each year to develop and implement the CSAS project. The project overall cost approximately $1 billion to implement, so we will be relieved of some of that funding. There are some unique things about California's child support program that are not shared by other child support programs throughout the nation. One of those is that we fund the entire cost of the courts that manage our system. We pay for, under AB 1058, we pay for court commissioners as well as court staffing to hear our cases, and that's approximately $50 million a year in our budget. And I think going forward, I think what we need to look at is greater efficiency in using our courts. A comprehensive fair hearing procedure is also one of the items that is in the child support area where there is a cost that we do not share with other states. Going forward, we have a revised fair hearing process that should be much more cost effective than the one we have been using in the past. Certainly the general cost of doing business in California is greater than in many other states. I think in a real sense, we have an inefficient business model for our child support program. We have a state-administered but locally operated program, and in each one of the local child support agencies, the directors and the employees work for the local board of supervisors. The State Department has control of the budget and certainly some policy issues and many of the regulatory issues, but it does make it a little less conducive to state strategic control.
I get the point that oftentimes California is in its own situation, and it's not always an apples-to-apples comparison when looking at other states. But it is very disconcerting to see that just comparing year to year within California from 2002, 04, 06, that we're getting ever less cost-effective as the years passed.
Yes, and that is very problematic for us.
Yes, I'd like to.
Senator.
Thank you very much. Many years ago, when I was brand new in the Assembly, I chaired the Committee on Information Technology and blew the whistle on SACS, the statewide automated child support system that was costing the state millions, hundreds of millions of dollars. And it's really important to us that we really be on track, build in the efficiencies, and there's been a spotlight and focus on this issue now for over 10 years. And we really are interested and concerned and would like to understand why the efficiencies, instead of improving, are going in the other direction, and what you're going to do to fix that.
Yes. Our CSAS project is without question the most complex public sector automated system created in the United States. I'm not a techie, but they tell me that there are 51,000 function points in this system, which is just an incredible number of systems. The system is a prototype. It is the first. There are no other systems like this specific system anywhere in the country. It had to be created from scratch. It had to be implemented without model from any other jurisdiction. So so far so good. It's up, it's running, it's fully functional. However, there were compromises made in the system to meet the federal funding penalty issues.
If I might interject, if you don't mind, I held 13 hearings on the previous system, and I do understand the whole area is extremely complicated. But my question really was, how come efficiencies are going in the wrong direction? What are you doing to fix it? I understand that it's really complex, and if your answer is I don't know, and I know you haven't been on a long time, I get that, but there needs to be a spotlight on it, because we've known for way over 10 years that there are penalties from the federal government, and we understand what we have to do not to get the penalties. So I'm not going to belabor the point here, and I leave this to our chair to help figure this out, but this area needs a lot of work, and I don't want to see it go in the direction of the old SACS program.
I don't think we're in danger of going that direction. However, as a new system, since we've rolled it out, there's currently 1,500 active defects that we're still working on in the system. That's inevitable, considering the complexity and the size of the system. There are also some functionality issues that were maybe skipped over during the rush for implementation that we are working on in the change request area.
Mr. Stroh, again, just to refocus, we're going to get to CSAS in our next item, and I know that Senator Ahlquist had maybe led you in that direction, but I guess I want to thank Senator Ahlquist for raising the question. Are we going to attribute all of our cost effectiveness performance level on CSAS? Are there other things that can be done to change the direction so that in 2 years we'll see our performance level increase as opposed to continue to decrease as we flirt with that minimum federal threshold of $2?
Yes, there are some things that we are working on changing in the system that will increase worker efficiency. Increase the number of things that the system will do in an automated way and relieve the workers at the local level from performing manual tasks. That will permit the workers, well, first of all, we will need fewer workers when we get to that point, but secondly, it will free the workers to work on tasks that directly produce collections for the system instead of working routine basically housekeeping tasks.
Very good. Does the LAO have any comment? Come on. You have no ideas how we could be more cost effective?
Thank you, Mr. Chair. Ginny Bella with the Legislative Analyst's Office. Back in May 2006, we actually did publish a report that speaks to some of the issues that Mr. Sturla was bringing up today about the state-county relationship and how it is a state-administered, county-run program and some of the inefficiencies that result because of that. Some of the things we pointed out were that the counties really don't have any fiscal stake in the program. They don't have a share of cost in the program. And they also don't benefit from any of the increased performances, or there's no consequence for not performing well. And so we did make some recommendations to more effectively structure that state-county relationship.
And have we ignored you?
I think that the conversation has, we have been focused on other things in the past, mainly sort of the project and getting some of that done. And as that has been completed, there is a shift to sort of looking at some of these other policy issues more closely.
I'm sure it concerns you as much as it does us that we are so close to that $2 threshold.
I think it is a concern because of some of the penalties that we have, that you have pointed out today.
Right. Okay, very good. Any public comment? As mentioned earlier, this is just an informational item, so we're not going to take any action today. So our next issue is CSAS. So, Mr. Sturla, we had provided a couple of questions that we wanted you to address, the current status and functionality, and also how the new system has improved, hopefully, child support services.
Well, it has. We have moved from 2 consortia systems, which were basically mainframe systems, to a web-based system that navigates very similar to the Internet. So it's more intuitive for the workers to use. It's a little easier to train on than the old drop-down menu mainframe systems, but there's still a learning curve because it is a very, very complex system with a lot of capability, but you need a lot of information to maximize that capability. Statewide, both case and financial data are available to all caseworkers throughout the state. There's a statewide update of case records, so each worker in each county need not necessarily update each and every change in information. It also gives us the ability to try to utilize our caseworkers statewide as a body and not as 52 separate LCSAs. For example, a caseworker in Mariposa County could work a case from Los Angeles County, and we're looking at those types of efficiencies. Client impacts, in some very fundamental ways, we've made it a lot easier for our non-custodial parents to pay their child support, which we think is a very important part of the process. They may now use credit cards to pay their child support. That's been a very, very popular program, both in terms of lump sum payments and in terms of parents signing up for monthly payment of their child support through their credit card. Automatic debit to savings or checking accounts are now available to our folks, and paying by check is, of course, still available, as is cash. Our custodial parents have the option of receiving their child support payments through either direct deposit or electronic payment cards, which reduce the amount of paper and checks that we have to issue. And we're issuing approximately 50% of our disbursements through these electronic means right now. Payments are distributed now statewide instead of locally by the individual child support agency, meaning that if an obligor has more than one payment, each custodial parent who's entitled to payment will receive a percentage of that payment based upon the proportion of the order. We have a web-based system called Customer Connect that gives all our clients the ability to contact the appropriate LCSA, ask questions, and provide data. We have a more robust telephone system called ECSS, which has not only created more capability among our LCSAs in the way we answer phones, but we have shorter wait times and greater access to information through those. Payment information is available to our clients, and as you might imagine, the most commonly asked question we get, did I get a check, or did I get a payment? That's now available 24 hours a day, 7 days a week, 365 days a year, either through the internet site or through our IVR. And so that's been a great convenience to our parents. As far as administrative impact, we now have the ability to download and report data on a local or statewide basis so that we can monitor performance on a regular basis. We have also eliminated the necessity for local child support agencies to do payment processing or bulk mailing. Statewide impact, since we have a single system statewide, we have the ability to implement statewide business practice and procedures, which is something we are working on now. We have the ability to reassign casework, as I indicated before, between LCSAs. We're also focusing on automation changes since we make those automation changes at a statewide level that are directed at improving performance and efficiency, and we have a greater ability to control costs since we have one automated system instead of either multiple systems or consortia systems.
Thank you, Mr. Sturla. Does the LAO have any follow-up comments on CSAS?
We would just concur with the staff recommendation on this issue.
Very good. And any public comment? Then, without objection, that we'll be adopting the placeholder trailer bill language. Issue 3 is revenue stabilization proposal.
Good afternoon, Chairman Leno, Chairwoman Alquist. Mark Beckley, Deputy Director for the Department of Child Support Services. We have submitted for your consideration our revenue stabilization proposal. I believe that we have a handout for this proposal. What we have seen over time is a correlation between child support caseworker staffing levels and child support collection levels. Since 2003-4, local child support agency allocations have been held flat. They have not been provided COLAs or cost of doing business increases for any local increased costs that they might have experienced. What we have found is that between 2002-3 and 2007-8, child support agency staffing levels have declined by a total of about 1,935 positions, or 23.4% of their staffing levels. During the same time, we've also seen child support collection levels decline from a growth rate of 3.7% to a negative growth rate in 2007-8 of 1.8%. We're submitting this proposal, which is to provide an augmentation for local child support agencies of $18.7 million, $6.4 million general fund, in order to stabilize local staffing levels and, in turn, stabilize collection levels. The department estimates that as a result of this augmentation, we will be able to retain $84 million in child support collections, $14 million of which go to reimburse the federal, state, and local governments for public assistance benefits provided. Of that amount, approximately $6.2 million would reimburse the general fund for local assistance public benefits. The remaining $70 million would actually go directly to families, and we estimate that this $70 million would benefit 22,000 families, which allows them to remain self-sufficient, stay off public assistance benefits, and provide for the needs of their families. We estimate that approximately half of these, 9,900, are people who are formerly on public assistance who, due to child support payments and under other funding sources, have been able to remain self-sufficient and stay off of CalWORKs and Medi-Cal programs. So that's our proposal in a nutshell. We have seen there's a question here related to a one-time augmentation in 2006-7 of $12 million. And that one-time augmentation was an augmentation that was provided late in the budget process. It was one time, which meant that local child support agencies really had to find activities of a one-time nature to use the money. So they used it predominantly for overtime costs, to have weekend hours, weekend office hours, to work child support cases. But they were very wary of hiring new permanent casework staff to work child support cases, knowing that the money would go away at the end of the year. Our stabilization proposal is proposed as a permanent ongoing base augmentation. This will provide local child support agencies the assurance that the money will be ongoing so that they can hire new staff and that staff can then be dedicated to new activities. Since we initially proposed this proposal and as part of the governor's budget, we have made two key modifications to the proposal. The first is that we have developed an allocation methodology which is performance-based. We're allocating the money out initially based on the number of casework staff per counties, so that those counties with the greatest number of caseworkers would draw down the greatest number of dollars. Secondly, we did a performance metric on this. So we are awarding more money to those counties that have better performance on collections on current support and collections on arrears. And we believe that those are key in terms of targeting the money to those counties that really will improve collections the greatest. So we believe that our allocation methodology will be effective in increasing child support collections. The second key modification that we made was to make receipt of the money by the counties contingent upon them submitting what we call an early intervention plan. Early intervention is strategies that a number of child support agencies currently use in order to interact with custodial parents and non-custodial parents early on in the child support order process to make sure that the orders are set according to their ability to pay and to make sure that they actually do respond to child support order requests. And Director Sturla can speak more on the early intervention aspect of the proposal.
One moment, please. Just backing up a little bit, Mr. Beckley. Wanted to ask about one figure you had mentioned. This is with regard to the augmentation.
Yes.
And the recoupment. We have $6.6 million of general fund, and I think I'd heard you say
that's correct. I believe I misspoke. 6.6.
Just want to clarify that. Very good.
Sorry.
Mr. Sturla.
Early intervention is both a national and in some counties a local strategy for both increasing collections as well as increasing performance on the federal performance measures. There's several types of early intervention. We have required each LCSA, each of the 52 LCSAs to submit an early intervention plan, and we required that plan to be submitted by May the 1st, and we have received plans from each of the 52 LCSAs by that due date. Two basic types of plans, and many of the plans mix both of the strategies. One is a pre-order strategy. One of the poorest paying cases in any child support caseload is a case taken by default. That's where the non-custodial parent does not respond to the legal process, and the order is set based upon either presumed income or some other level of income. Those orders pay at a very, very poor percentage. An early intervention plan in Orange County, the county I came from, involves focusing pre-order focus on those non-custodial parents, and they've been successful in about 50% of those cases of getting stipulations. Stipulations pay actually at a greater rate than cases that go to court. And we're talking about a difference in performance of about 65% to 70% on stipulated orders as opposed to about 25% on defaulted orders. So it makes a significant improvement by involving the parent. The other type of early intervention is intervention after the order is established, and this involves good old collection techniques, getting on the telephone right after the order has been established, making contact with the NCP, reminding them of the obligation and the consequences of not meeting their child support obligation, and then following through on that with both letters and personal contact. A pilot project was run in Monterey County, and they were able to improve. They collected approximately 55% more on these cases than they did on their control group. So it's a proven methodology. This was a no-brainer as far as requiring that this be done by the LCSAs, and I'm gratified that not only did all 52 submit these plans, but they're actually they're very enthusiastic and engaged in implementing these plans, and they will use the staff that they're either able to maintain or hire to work these plans in part.
Thank you, Mr. Sturla. LAO, you have alternate proposal?
Yes, Mr. Chair, thank you. As your agenda indicates, we did present an option to create a voluntary matching program for LCSAs wishing to access the stabilization funds. Our option would use the same amount of general fund as the administration's proposal, but allows for the leveraging of additional federal funds beyond those included in the administration's proposal, because it uses both a combination of the county matching funds and the state funds to draw down federal funds. And because in total it is putting more money into the child support system, we believe that it increases the likelihood that the investment in the stabilization option or proposal before you would result in increased collections and a net benefit to the general fund.
Thank you. Do you have any response, Mr. Sturla?
Only that we want participation in this process throughout the state, and we think that the counties, well, many counties, if not most counties, could not afford to participate in this case. They have not invested any dollars in the child support program and would not choose to do so at this economic crisis time, and therefore we would receive poor participation, and we would not realize the results that we need.
All right, very good. And before we go on to public comment, the fourth question, if you could just address how you're going to track and assess any additional monies through the augmentation.
Yes.
Mr. Chair, if I may, John Wardlaw, Department of Finance. One further note, relative to the counties being required to match, we're not certain that those counties that would be able to match, if those would be the top performers out there. So you could have a situation where many of the counties simply can't because they don't have any money. Those that can may not be the best performers.
Okay. Thank you for that addition.
Yes. Tracking particularly the success of early intervention. We have gone to our IT folks and we have told them that we need to be able to track these cases as they go through the county. They have created an indicator in our CSE system, something that they could do relatively well. They could do it in-house, so it did not. There was no money spent on change requests on this, and then we will be able to monitor the performance of those cases against the general caseload and report back here the success that this intervention has had, and the improvement in collections and performance in this particular caseload.
And how about additional augmentations other than in early intervention?
Our expectation is that this money will be spent, if not all for caseworkers, almost exclusively for caseworkers, because they are the ones that are the driving force behind the collection process. And we will, I'm not sure we have done that, but we will have a system in place to monitor the use of that money and to make sure that money is used for caseworker resources.
And just looking at page 17 and the proposed placeholder trailer bill language, number 4, that LCAs shall be required to use and assure that 100% of the new funds allocated are dedicated to maintaining caseworker staffing levels. All right, public comment. You've been very patient.
Good afternoon, Mr. Chair and members. Tia Orr with the Service Employees International Union, and we are here in support of the governor's proposal for increased funding to local child support agencies. I do have a couple of my members here from Los Angeles County who I would like to give my testimony to so they can speak about their experiences, but would like to note a couple of concerns with the recommendation, specifically the possible sunset date for this funding. I think many of you know that when counties get a sunset date of funding, a lot of times it makes it difficult to hire additional staff because that staff would then, of course, be let go once the 2-year funding ended. So we are concerned about that possible sunset date. Also a concern with the performance measures and meeting the performance measures. We're concerned for the larger counties, specifically such as Los Angeles County, where workload is a little bit more tedious and difficult than other counties, and so meeting those performance measures at a certain threshold may be difficult, but I think it's smart to look at their progress in those performance measures and use that as a possible way to see whether or not the funding should continue.
Thank you.
I would like to divert the testimony to
Very good, and as you know, this is placeholder language, so the conversation will be continuing.
Thank you so much.
You bet. Thank you. Welcome.
Hi. First of all, I would like to thank you for allowing us to come and
If you could just get
represent.
a little closer to the microphone. Great.
Okay. First of all, I would like to thank you for allowing us to come and visit.
We thank you.
Okay, thank you. I've been with the county for 17 years. My name is Maria Sanchez. I represent Los Angeles County, and I just want to address the issues that the experiences that I had over the 17 years with the two systems that we've had in the past, with ARS and now with CSAS. During those years, we've always had a limited staffing in our department. And now that we have this new system, no matter how sophisticated it is also a problem for us, especially during this time when we are facing recession with a lot of constituents losing their jobs and being homeless. So it makes our job very difficult to locate these people. And then when we do locate them, there's no way we can establish paternity or set an order because this person is not capable of doing it. So that makes our work even more difficult to work with. So we're supporting the governor's budget so we can have more funding to maintain our program running through Los Angeles County.
All right. Thank you, Ms. Sanchez.
Thank you.
Good afternoon. I'm Esperanza Nastos, and I would also like to state that our workload has increased tremendously with this new system, and our main goal is to help all the families that come to us for help, and this money will help us to do that. Okay.
Thank you, Ms. Nastos.
Thank you.
Good afternoon, Chairman Chairman Leno, I'm sorry. Different week. Senators of the members of the committee. I'm Ileana Rodriguez, president of the Directors Association here in California and director for San Mateo County. I would like to indicate our endorsement for the Governor's Revenue Stabilization Fund. All 52 counties have signed on to the early intervention plan. As Mr. Sturla has indicated, it is a no-brainer. For those counties who have it in place, it's an ability to keep this labor-intensive project in place, and those who do not, to hopefully bring up our performance. Without it, polling counties around the state, we would lose an additional 230 positions. 100% of the funding will be dedicated to FTEs and these early intervention funds. So I encourage you to adopt the trailer bill language.
Thank you, Ms. Rodriguez. Any other public comment? If not, the motion of the committee will be to approve the revenue stabilization funding with the directions and placeholder trailer bill language to be found on pages 16 and 17. Thank you, gentlemen.
Thank you.
Department of Social Services, Child and Family Services Review. Mr. Rose.
Yes, thank you. So, Chairman Leno and Senator Alquist, Senator Alquist.
She'll be right back.
Sorry. I bring greetings from Director Wagner, who had intended on being here this afternoon, or this morning with you when the hearing was in the morning. He had a previous speaking commitment, and when the floor session ran long, he...
Understood.
I do have his written testimony to provide to the committee if you'd like that.
Thank you.
And I did want to also mention a couple of things that you'll see when you read it. First of all, he wanted to acknowledge the work of the legislature in grappling with some of these difficult issues, that especially in challenging fiscal times, and he wanted to also acknowledge the help of staff that has provided his team in preparing for the hearing. Also, he wanted to spend a bit of a moment just touching base on one of the proposals that we'll be talking about a little bit later this afternoon in terms of child safety. And he mentions that at the macro level, these staff help California meet federal reporting requirements on child fatalities and near fatalities. And at the micro level, we've seen with a number of recent fatalities in some counties that we were able to go over individual reports, case plans, and provide guidance to the county on ways to improve their practice. And this guidance made its way into the county's improvement plan and into an outside consultant report. And furthermore, we were able to use this information to focus some of the state's training resources to meet specific needs of that county. So you have his entire testimony before you, but I wanted to point out a couple of the highlights that he had asked me to bring to your attention.
Please.
With that said, I'll move on with the agenda if that works. The first item up for discussion is the Child Welfare Services system. I'm sorry, the Child Welfare Services CFSR and Program Improvement Plan, and we were asked to just to give an update on that. As you know from the agenda, the governor proposes a package of local assistance premises to help implement this plan, totaling at roughly $36 million in funds. The numbers I mentioned here are slightly different than the ones in the agenda because ours, these numbers that I cite include the 4E waiver counties portions of that too. So I wanted to mention that so certainly the agenda does a good job at describing the process in which that led up to the program improvement plan, and it and wanted to mention further that we developed the program improvement plan with a broad group of stakeholders in a collaborative manner, and that process yielded 6 strategies, and these premises are to support some of those strategies. The specific question in the agenda has to do with kind of where we are. So we're projecting that the program improvement plan will be approved sometime this summer, likely. We've been hearing sometime in July. It has been submitted to the federal government. The 30-day kind of formal process for negotiation has not started yet, but we've had a lot of preliminary conversations. Just to point out, once it's approved, the plan is its duration is 2 years, followed by a final year, a third year, where that allows the state to submit data to demonstrate that it's made progress related to the interventions tried in the first 2 years. So the first time that we would likely see exposure to penalty, which is the other part of the question, is July 2012. We were also asked to touch base briefly on how we would implement the relative search and engagement and the participatory case planning aspects of the program improvement plan. And in general, with our PIP, we are trying to build on areas that have been in existence that through this collaborative process that have been identified as working and promising, and we also will continue to work with stakeholders throughout the 2-year period. With respect to participatory case planning, We plan on developing some protocols related to our 11-county pilot that tested a number of some early intervention strategies and some engagement strategies with youth. We are in the process of embedding training for team decision making, which is a model that it's very participatory in nature, into our regional training academy structure, and we're also updating core curriculum for social workers that would model that practice. With respect to family finding and engagement, we're again want to build on some of the good work that we've noticed in many counties related to permanency for older youth, and this work has relied heavily on family finding engagement, and we need to continue our conversations with those counties, and the preliminary conversations seem to indicate that there's a need for training and protocols as well as the funding in this in the proposal. Finally, the last question in this area asked about our efforts at caregiver recruitment, retention, training, and support. And our approach to caregiver support will begin with conversations to identify the support needs of caregivers through a state-level caregiver advisory group. This group will continue to advise the department on an ongoing basis related to training and to policy issues. We plan on inventorying existing regional and local caregiver advocacy and support organizations and work towards developing a caregiver advocacy network. And the goal of the network would really be to enhance communication and problem solving at the local level. And finally, we're really excited to tell you about a partnership that we have with the Youth Law Center, with the CWDA and the Stewart and Annie E. Casey Foundations to develop a statewide resource family recruitment campaign. And with respect to that campaign, we intend to use current research and social marketing methods to attract and retain new resource families.
Very good. Very comprehensive. Thank you, Mr. Rose. Do the welfare directors have any thoughts with regard to question on page 20?
Yes, thank you, Mr. Chairman. Frank Mecca, Executive Director of CWDA, and I'd also like to echo Director Wagner's in absentia comments acknowledging the legislature's leadership in this area, and I'd also like to acknowledge his and Mr. Rose's and the Schwarzenegger administration's support for child welfare, which has been heartening and bipartisan. With respect to the specific item on the agenda, we worked in collaboration with the department in identifying those areas of program improvement that we could move the ball forward on in California. And so we concur with largely with the items that are in the state's PIP, and we're part of the development of those items. We also are very appreciative of the fact that in a very tight budget time, the administration was able to add additional resources for some of the new activities that the program improvement plan would require. The concern that we have today is on the requirement that there's a county match in order to access those funds. There is a county match in the child welfare program that was established in the early 1990s as part of the realignment legislation. Since that time, despite improvements in funding, the program remains very significantly underfunded vis-a-vis any reasonable benchmark, including the state's own study of appropriate social worker workload standards. For the past decade and a half at least, counties have contributed significant amounts of overmatch. That is to say, county funding over and above what's required to draw down state funding. The counties that both of you represent have a substantial amount of additional county funding invested in the child welfare program. In this budgeting environment and given what's happening locally, much of that overmatch we think is going to be reduced or eliminated due to local budget cuts. We are very worried that the additional funds that the administration has made available for the PIP will not be accessed because counties simply won't have the ability to draw them down. As we understand the proposal before you, there's no mandate that the counties draw down the funds, and I don't think that there's an enforceable mandate that we implement steps that the state would like us to implement, even if we promised the feds that we would do so. And so we're really in a situation where the state will hope that counties can implement steps, and we're afraid that many counties simply won't be able to. Given the really significant county investment in the child welfare program, I think it's clear that the county's commitment, we're talking the talk and walking the walk, and we've made a huge financial investment in this program. What we would ask you to consider is to buy out the county share, or to not require a county share to access the funds, so that we can be assured that the counties will be able to implement the steps that are in the state's program improvement plan. We believe we're jeopardizing, we're putting the state at risk of significant federal penalties if the state cannot assure the federal government that we'll do what we're promising to do. And I think that's the situation we'll be in, absent some remediation. So we'd appreciate your consideration of that.
In a perfect world, there'd be no debate. Thank you, Mr. Mecca. Any other public comment?
Thank you. Danielle Millay with the Child Abuse Prevention Center. And we just wanted to echo Mr. Mecca's comments. We want to thank you for your great work in the department, and just be cognizant of the county match that's required for some of these programs, and the fact that counties are currently having to face their own budget cuts, and we are seeing a decrease in the child abuse prevention funding as a result of having to fund the mandated programs at the county level. And that in this time with this economy, we are seeing an increase in child abuse cases. So trying to be aware of counties being able to continue to fund the prevention programs so we can keep children safe and keep them out of the system in the first place.
Thank you.
Thank you.
And Leo, any comment?
Thank you, Mr. Chair. Minsun Park with the Legislative Analyst's Office. We just add that given the risk of federal penalties if we don't improve on our child welfare outcomes, we concur with the staff recommendation. Thank you.
Very good. Thank you. So with that in mind, to avoid the penalties and improve outcomes, we'll move to adopt the placeholder trailer bill language that's found on page 19. Without objection. Child safety.
Thank you. This item is an item that I referenced earlier in the director's opening remarks. It's a proposal that would establish 2 permanent positions and a limited term position in my division to work on a number of things related to fatalities and near fatalities. The question first starts out with asking about the CAPTA requirements and how we meet those. And I think there are a number of CAPTA requirements. 2 are most relevant to this discussion here. One is that CAPTA requires public disclosure of related to child fatalities and near fatalities as a result of abuse and neglect. And as noted in the agenda and the question below, fatalities are now the responsibility of the counties in terms of public disclosure of information post SB 39. The department still retains the responsibility for the near fatalities. The second requirement that the state that's important related to CAPTA is that the state is required to do an analysis of child fatalities and near fatalities as a result of abuse or neglect. And there's an expectation that the policies and practices that we issue will be revised accordingly to reduce the likelihood of future fatalities and near fatalities. And this particular aspect of CAPTA, the Child Abuse Prevention and Treatment Act, is made a little bit more problematic with the recent demise of the Department of Justice Crime Prevention Center that kind of worked on that supported the State Child Death Review Council. And so historically we've relied on some of their work and our work to try to provide a state-level analysis and trends. I should also mention that as we sit here today, we still are under federal corrective action related to this federal statute. The next question that we were asked to respond to talks about the workload related to public requests for information around child fatalities and state and county responsibilities. And I wanted to mention that it's certainly true that the disclosure of fatality information is at the local level. We still remain responsible to review the child fatality information provided by the counties, review case-level information, and work with our county colleagues to better understand the circumstances surrounding fatalities and near fatalities with the goal to prevent reoccurrence. Our staff needs to track trends and circumstances to determine systemic issues that may be contributing to these negative outcomes. And we still continue to get media inquiries and Public Records Act requests that we need to respond to. You were interested in the number of these, the number of such reports, and each year since 2000, we've seen an increasing number of these reports from counties. In calendar year 2008, we received 132 reported fatalities and 95 reported near fatalities. Currently this year, we're at 55 fatalities and 30 near fatalities. Our current backlog for reviewing...
That's to date?
To date.
Okay. And quick bit of math, if I heard the figures earlier, we're a little below last year?
We are a little below, so it's possible the trend is changing. It's hard to tell, but we have seen an increase until at least till this year.
Good.
And I should also mention that that sometimes the reports come in sometimes the reports come in significantly after the fatality or near fatality, well, after the fatality occurred, because it may be a decision of the coroner that they determined later on that it was as a result of abuse or neglect. That said, our current backload is about 250 cases that we have yet to look at in any significant manner. Finally, yes.
One moment. Senator Alquist has a question.
Thank you. I have two questions.
Sure.
The first one is, what is your responsibility for preventing children's deaths, as opposed to reporting that they have died?
That's a good question.
And that's the harder one. The second one will be easier.
Okay, fair enough. The department has an Office of Child Abuse Prevention, and we have a number, and through that Office of Child Abuse Prevention, we manage a number of federal grants related to prevention and early intervention. Much of those funds are allocated out to counties, and counties provide us with plans about how they want to use their prevention and early intervention dollars. We provide some technical assistance, some guidance, some evidence-based practices related to try to prevent and intervene early in child abuse.
So a follow-up to that first
Sure.
question is, what percentage of time do you spend on preventing deaths as opposed to recording them?
I would say that it's hard to say given the fact that we have this backlog, but we actually have an entire bureau, an office of 20-some-odd people whose full-time job it is to work on prevention and early intervention, and we have no dedicated resources whatsoever for this activity. I think it's safe to say we spend more time trying to prevent than we do reporting.
Okay. You might work on a better answer.
Yeah.
I mean, you say more or less, but it's not a number. And I would think for what you do, you ought to really know whether it's 60-40 or 40-60 or 30-70 or whatever it is. I think we'd be interested to understand that. The other
Certainly.
question, which is the easier one, is,
Okay.
Right, so if you could work on that, let us know.
Sure.
The committee know. The other question is, why were we out of compliance with CAPTA, and what are we doing to rectify that?
The primary, there were two primary reasons that we were out of compliance with CAPTA. The main one was that our state statute precluded the level of disclosure that the federal federal counterparts require, and that federal law requires. We address that in SB 39. They also have called us into question on our level of our level of analysis and using the data that we have to in fact change policies and practices in California. So we are attempting to use our resources to analyze the data to see what story the data can tell us that would help us identify areas in the system that we can improve upon.
So are you saying that the federal government, I'm making some assumptions I need to understand
Sure.
if I understood correctly.
Sure.
Are you saying that the federal government was saying that you did not give enough, you being the department, give enough finite, detailed information, and that you need to come back and present more, or?
It related to the analysis or related to the case-specific kinds of information?
However you want to answer that.
Okay. They said both things to us. They said, first of all, that the federal law requires public disclosure of more information related to the specifics of fatalities that happen as a result of abuse and neglect. And they have told us that because it's a requirement that we receive this information, that we need to do more with that information in terms of identifying critical areas in the system that could be improved.
So they're really speaking to efficiencies, improvement, how you're going to make it better. And,
yes.
And I'm going to stop here because I could go on another hour, but you are working on addressing those concerns?
We are working on addressing those concerns with the limited resources we have. As you can see, we have a backlog of 250. So,
right. Thank you very much.
Thank you, Senator. Had you finished with regard to the third question? AB 636?
We haven't started.
Okay.
Basically, AB 636 has three basic components. There's a county self-assessment that includes a review of outcome indicators and input from local stakeholders. There's a case review to better understand aspects of case practices, and through the use of those two processes, as I mentioned above, both the qualitative and the quantitative aspects of the local child welfare system are assessed, and a subsequent system improvement plan is developed. Our staff plays a role working with their county partners throughout the life of that sequence, and continues to work with their county partner throughout the life of the system improvement plan. The system improvement plans are approved by the Board of Supervisors and by the department, and oftentimes, and so it's a collaborative process where both state and county, with stakeholder involvement locally, identify some areas that folks could be working on to improve their systems.
Very good, thank you. LAO, any comments? Any public comment? Given that we've just approved the funding for about $20 million in the earlier item, which I think is going to be more effectively used than the request in this item, the motion is going to be to reject the funds.
Well, thank you for at least letting us talk with you about it today.
I wanted to do that. So the next item is non-provisional foster care audits.
Yes, so the world of foster care audits and rates is a complicated one, and I'm going to try to talk about it very succinctly and briefly. Our proposal is in response partly to the budget crisis that we see ourselves in, that the department really needs to better utilize its limited auditing resources, and that there are federal requirements for all three: program, fiscal, and financial audits. And this trailer bill will provide us with the flexibility we need to conduct all three types of audits with the limited resources. With respect to some of the specifics of the proposed language, we're suggesting for these program audits of existing providers, that we reduce the audit period from 3 to 12 months, and that'll reduce the number of days on site, and it will also reduce the number of hours to complete the audit. It will eliminate the assessment of overpayments altogether and replace it with a more immediate rate classification reduction. There is a formal hearing process involved, and that we would continue to work with corrective and retroactive restoration of the rate. So it allows the providers to continue to work towards the original rate classification. In some cases, we'll still need to do 12-month audits. In those situations, both corrective action in both the formal and informal appeal rights will continue, and overall we expect to conduct more shorter audits and less longer audits.
And the impact on group homes?
Right. We think that group homes will receive more timely information about compliance with the rate requirements, and will make corrections more quickly. Providers will have to spend less time preparing for hearings. We think we know there'll be fewer overpayments assessed, and one of the main reasons that many group home providers go out of business is a large overpayment that they can't figure out how to pay, and that we think that we'll also be able to provide more training and technical assistance, and historically when we've been able to do that, we've noticed a less need for corrective action.
Thank you. LAO, nothing? Public comment?
Jennifer Snyder on behalf of the California Alliance of Child and Family Services. We are okay with the trailer bill language as written, but we have to make a note of our concern with the expanded use of audits and the expansion of the audit program. Looking at an audit program that oversees a rate classification and a rate reimbursement schedule that we believe is completely outdated and doesn't really actually reflect or reimburse group homes for the needs of the children. Senator Alquist was part of an effort and a bill that was passed that actually is hopefully moving the department to reform that rate setting system, and we would continue to encourage the department to use their resources to look at this rate classification system and rework it and make sure that we're paying providers what adequately covers their costs rather than spending too much time auditing a program that doesn't work.
We appreciate your comments.
Okay.
No other public comment. We're going to adopt the amended placeholder trailer bill language that can be found on page 24. Given the tough times, the least we can provide is some flexibility.
Yeah. Thank you. Thank you.
So issue 4 is Title 4E waiver project.
Right. So our proposal that you have in front of you is asking for resources in the terms of 5.5 permanent positions that will be dispersed through our program, legal, and fiscal shops. And also for some resources to conduct an independent evaluation, which is a federal requirement. The questions that we were asked to respond to have to do with the department's role and status and impacts of the current waiver. And I'd like to mention that as a result of the waiver, over $67 million more federal funds were expended by the 2 waiver counties than they would have been eligible to expend under current 4E rules. And collectively, the 2 waiver counties have realized reinvestment dollars in excess of $30 million total funds. And under the terms and conditions of the waiver, those funds can be reinvested and moved into subsequent years. Both counties have done a number of things programmatically, and specifically both counties have expanded family finding, have focused on team decision-making, and expanded their differential response, which is an early intervention strategy. Alameda has implemented an enhanced caregiver approval process at their assessment center, and this links children to extended families more quickly. And Los Angeles County has done work on what they call upfront assessments, which are comprehensive assessments that better target services to risk. And both counties have done a number of programmatic things for their probation population as well. With regard to the department's role, our staff work on the ongoing development of budgeting, allocating, and claiming for the waiver counties. In essence, we're running two separate allocation and accounting processes, one for 56 counties and one for the waiver counties. We provide training to counties on the new database, the new claiming database. We meet with the counties or have conference calls regularly. We have submitted, we are required to submit and have submitted semi-annual reports to the federal government. Most recent one was March, the end of March of this year. We are required and need to continue to work with the federal government on the impact of ARA and on the new Fostering Connections to Success Act to work on how those two federal laws will affect waiver, the two waiver counties and the dollars available to them in their flexible funds. We have to conduct evaluation stakeholder meetings. We meet with our evaluation contractor. We have a number of internal meetings that we need to continue to do, and we attend the annual 4E demonstration meetings in Washington that are also a requirement. With respect to evaluation of the waiver, the state's evaluation is required to have an interim evaluation report at the end of February 2010, and the final report is due December of 2012. And it should be noted also that LA County is doing some supplemental evaluations as well.
We have reason to believe that the evaluation will be on time.
Yes.
Good. Okay. LAO? Public comment? So without objection, the committee is going to approve the 3.5 for the duration of the waiver, but given our tough times, and the evaluation funding, but denying the other two.
Okay. Thank you.
And DDSD furlough program. Thank you, Mr. Rose.
Thank you.
Mr. Carlin.
Good afternoon, Chairman Leno.
Good afternoon.
Senator Alquist. My name is Joe Carlin. I'm the Deputy Director for the Disability Determination Service Division in Social Services. You've asked me here today to answer some questions about how the furlough policy that the state currently has is applied within our division and the impact that it's had. So I'll just run through the questions and give you the answers. Firstly, you've asked me to describe how the furloughs are currently being applied, including at DDSD. Each full-time staff member at CDSS receives a 2-day furlough leave credit every month with an associated 9.2% pay reduction, not only in our department but across state service that's happening. These credits are treated like all other leave credits that staff received. Prior supervisory approval is needed before they can be used. And all of the furlough leave credits are required to be used prior to June 30th, 2012. In our division, we have long-standing policies on leave usage, how we assign work, workload reassignment in the case of a long-term leave use, and absence coverage for staff who aren't there. Basically, we treat the furlough leave like any other leave that staff is credited. Do you want me to elaborate any further on that?
Please proceed. We'll hold our questions to the end.
Second question.
Until we can no longer contain ourselves.
What, if any, are the savings the state achieves by furloughing DDSD employees, including those in the federal program? The federal program staff are 100% federally funded, so there's no general fund savings in that portion. Our state program staff, a much smaller segment in my division, does generate some general fund savings. It's funded 50% federal and 50% general fund.
With regard to your just completed statement,
yes,
it just seems nonsensical, and I know that there have been some news reports around this. Because the effect is we're leaving federal dollars on the table, and at the same time risking potential eligibility of Californians. Why would we do that?
Well, I was not at the table when these decisions were made, so I can't speak to the, to the administration's overall strategy, but I can tell you from my point of view as a manager of a large division, if I had a portion of my staff that was affected by the furlough, and I had another portion of my staff that was unaffected by the furlough, it could create some very difficult issues with morale. It could ultimately end up that the people who were serving would see some effects from that. So I can see the fiscal point of view, that's one point of view, and I certainly understand Social Security Administration's point of view. They've made it very clear to the state. They've made it very clear to any newspaper that would listen. But there is another point of view, and that's managing the process as it plays out across all of state service. And I know that there are, we're not the only department that has 100% federally funded positions, and my assumption is that if we entered a process where some people were granted exemption to furlough and some people weren't, that there would be morale and other issues.
Okay,
so it's just another side to the
I understand. That is the management perspective. And I see LAO shaking their heads. You're going to have a moment to respond after you complete the rest of your answers. So then we want to get into the nuts and bolts of this. So we've got folks furloughed. How is that impacting caseload and the task at hand?
Right. How has the overall number of cases for DDSD to process changed in the last few months since the furlough has been in effect? If so, what were the changes? In both state programs and our federal program, we've seen an increase in the number of new applications for Medi-Cal and for SSDI and SSI disability, but these increases in workload are unrelated to the furloughing of staff. Whenever we see an economic downturn, generally there are more people in need for all kinds of programs. Ours is no exception. In our federal program, we've seen an overall increase of 13% in new applications since October 2008. And responding to the increased need of disabled Californians, we have increased our case assignments to our staff by 1 case a week. We have a long-standing agreement with SEIU that represents all of our disability analysts that caps the number of cases that we can assign to the average analyst on any week. We are operating within that cap and within the agreement we have with them. But in general, our approach is to assign as few cases as we can to be as efficient as possible and keep up with the workload. We just saw the need at this point in time to increase the workload slightly. In state programs, we've seen an approximate 5% increase in new applications. Shall I move on?
Sure.
How have furloughs impacted applicants for disability benefits? And specifically, what was the average amount of time for processing applications prior to the furloughs? Has it changed at any time as a result of the furloughs? And for state programs that handles Medi-Cal disability applications, the 3 furlough days where our offices were actually closed resulted in approximately 900 claims, new claims, not being assigned to staff. That's resulted in minor delays in assigning new work since that time. However, the year-to-date average processing time for all state programs cases for the week ending February 6th, the first week of the furlough, that was 70.3 days. And the year-to-date average processing time for the week ending May 8th, last week, was 70.2 days.
So you went from 70.3 to 70.2?
Yes, so we're processing cases at virtually the same speed that we were before, but we're running a slight backlog in assigning new work. So in my mind, we've been able to maintain service to the Medi-Cal disability applicants. For the federal program that handles SSDI and SSI disability cases, you've noted in the background description that our February initial claims average processing times were 79.4 days for SSDI and 83.5 days for SSI claims. Our April initial claims processing times, which is the most recent data that we have from the federal government, it's 75.9 days for SSDI and 80.4 for SSI claims. That's approximately 3 days faster service for both titles that we handle. We continue to provide faster service to disabled Californians than the average state across the nation. And then finally, what has been the impact of the furloughs on the workload for staff responsible for evaluating cases? Has the amount of authorized overtime increased since the furlough began? The 3 furlough days when we closed our offices in February and March resulted in some catch-up work for staff in our federal program branches because we didn't assign new work to them on those days when nobody was there. What we did, we offered overtime to volunteers who were willing to accept additional cases because we had a backlog from those 3 days, and we were able to assign the approximately 4,500 new claims that came in on those 3 days on a voluntary basis, and we've allocated 18,000 hours of overtime to cover that workload. And again, that's 100% federally funded, so there's no impact to general fund having done that. For our state programs branches, we have authorized some overtime for general operational use. We have much less flexibility in that program because we do operate on 50% general funds, and that overtime was generated by unfilled position savings. And that overtime was in the hundreds of hours, not the thousands. So, in summary, for both programs, the workload impact from the furlough program itself has been minimal. We've been able to manage it. We're able to manage leave usage as we always do in order to maintain good public service. What we have seen, however, is an increase in the number of initial claims coming in.
Due to the down economy. Thank you.
Yes.
Ledge Analyst.
Todd Bland with the Legislative Analyst's Office. I'm not our expert on personnel matters and furloughs and this, so I may not get this exactly right, but I'll sort of take a shot at it. I think Mr. Carlin did kind of a good job of explaining it. Yes, many workers in the state some are funded general funds, some are funded with a mix, some are special funds, some are federally funded. There's whole departments, in fact, where there are no general fund, but the furloughs were applied to all. The furloughs are sort of a blunt instrument in terms of a budget balancing tool because, along the way, you're going to get areas where, we aren't really achieving any savings, but we are having service reductions. Or Mr. Carlin indicated how they worked very well to try to avoid those. But again, we also have laws and collective bargaining agreements that basically we have to treat our workers more or less the same. And to the extent you created exceptions in furloughs for federally funded positions or special funded positions, you could have the morale problem Mr. Carlin mentioned, but even more than that. You could have people applying for those jobs. Basically, you could start having vacancies in the state-funded positions.
I doubt we'd have vacancies in a downturn like this.
Well, anyway, we recognize that it's not the most efficient tool for achieving savings, but in a very difficult budget environment like this, a lot of our we need to achieve savings. A lot of our tools are not very good.
Tell me
again,
if this
I'm not the super expert on
this. Just for discussion's sake, tell me if this is not a good analogy that there were criticisms of the administration when there were talks going back last year or even the year before of just across the board 5%, 10%, that it was blunt, it was not a thoughtful way to go about dealing with a budget problem because we have some programs that are cost effective and efficient and actually work. Why would you want to cut those back? And we have others that are ineffective and not cost efficient. So that wasn't a good thought. So if it's not a good idea from a perspective of efficiency, why is it a good idea with regard to federally or state-funded positions?
Again, our office, yes, we were critical a year ago of kind of that across the board. Well, I get lost. Was it a year ago or 2 years ago when we did our alternative budget?
It all turns into a big cut.
Point well taken. But at this point, we need to search for solutions all over the place, and this is an example of solution. I think it's more like how do furloughs work relative to other solutions. They have their drawbacks, as we've discussed today. Other solutions have their drawbacks, too. So.
Sure. Fair enough. Okay. Public comment.
Chairman Leno, Senator Alquist. First of all, I'd like to thank you for bringing this issue to the public. It's an important issue. My name is Randy Cheek. I'm with SEIU 1000. We represent the DDSD employees, especially the analysts. I brought with me today one of our analysts from our Roseville office, Lorraine Bustamante, who could answer some of the questions that you have presented. I'd like to point out that these jobs, the analyst jobs, are not jobs that people can just laterally transfer into because they're a specialized job. So therefore, you're not going to have a lot of state employees going from one agency to another agency like you would with this agency. So that's sort of a moot point. But we do understand that the furlough problem is a major issue. We do have a lot of agencies who are covered with federal funds, with the lottery, for example, with gambling. SCIF is another agency. So these were just, it was a blunt instrument used across the board that was, in my opinion, unnecessary. So I'd like to have Lorraine answer some of the other questions.
Good afternoon.
Hi. Hi, Joe. Okay. I'm a Disability Evaluations Analyst 3 in the Roseville Disability Determinations branch. I've been with the program since 1988, minus a brief 3-year hiatus when I went and did something else.
A veteran.
Yeah. As Mr. Carlin said, we do accrue 16 hours of furlough leave, and we get to take that with pre-approval by our supervisors. These are unpaid leave days because our leave, our pay has been docked, yet we do receive our full complement of work when we use this leave time. We receive an average of 3 new cases every day, and no contingency work is done on pending case actions. So that when the adjudicator returns after taking this unpaid leave, they return to 2 or more days of backlogged work, and if staff takes 3 or more consecutive days of leave, new case receipts do not stop, and contingency work doesn't start until the 3rd day that they're out. So if someone takes 2 days of their furlough leave off, that work sits there until they get back, and then they're expected to be able to catch up in their 8 hours each day. Basically, this mechanism discourages the staff from taking their time off for which they've already lost pay. They're also receiving work for time that they're not being paid. Talk about a blow to morale. Question number 2, there are no savings to the state since our program is 100% federally funded. In fact, it's my understanding California receives additional money from the federal agency for administrative indirect costs, and this funding has been reduced as a result of the furloughs, and I believe my colleague will be speaking more about that. Another negative impact is that due to the increased, let me see if I can put this right. Due to the increased workload that we've received and the reduced time that we've got to get it done, even though the statistics look like we're providing the services in the same or less amount of time as before the furloughs, I don't think we're actually going to see statistically the fallout until June. Okay? It just takes time for us to process these cases, and as they close, then those numbers get rolled into the stats, right? As the applicant is waiting for their determination, they continue to receive county or state aid, which I think is a detriment further to the resources that California has at this time. Statewide, we have noticed an increase in applications. All of our branches have received a higher number of cases since the furloughs. I don't know, it's like Mr. Carlin said, it's more of a correlation rather than a cause. However, individually, we have seen over the last several months, especially in Roseville, adjudicators have received 15 to 20 cases per week, whereas before the furloughs, they received 12 cases per week. Another blow to morale. Here you've gotten a cut in pay, you're being forced to take time off. Here's some more work. Okay. In the past 3 months, we've also seen, at least in the Roseville branch, I don't have the reports with me, but personally I notice an increase in the average pending caseloads by 25 to 30%. People are starting to sweat. The people actually doing the work are worried, and they've got managers leaning on them. Why aren't you getting it done? Impact on the applicant, we've got an increased workload, less time, more backlogs. This is going to naturally lead to an increase in processing time. The applicants wait longer for their decisions, and some die waiting. I work in the quality assurance unit. We review cases for accuracy. Personally, I see the effects of the pressure to deal with the rising workloads. Adjudicators try to close cases with shortcuts and bypassing procedures, or they just overlook things because they're in a hurry to get cases closed. They've got management coming to them, why haven't you taken any action on this case? Well, because I've got 100 other cases that I'm trying to get closed too. Okay, I'll get to that one right away. And they shortcut. I've seen cases practically cut clean in half trying to get that case closed. As a result, we review them, we return them, they take the action necessary. We're trying to make more efforts to review more cases, to try to catch these errors before they leave the building. But this is also turning into an unreasonable case review expectation in our unit, and we're starting to experience backlogs in our, amongst our own staff. And we're faced with the options of either performing more cursory reviews or allowing our work to back up. And we're struggling with those issues right now. Both of those would be to the detriment of the applicant. The impact on the workloads for the disability analysts, again, the pending caseloads are going up. The processing time is going to be impacted. They're being told to take shortcuts and workarounds, and potentially prematurely denying claimants their benefits, with the philosophy that the applicant can always appeal. Overtime has been granted only for the purpose of accepting additional cases to process. Let me see. I think that was all I needed to say. Yes, furloughs are a blunt instrument. I likened it to a, tear the house down response to a roof needs repair problem. Thank you.
Thank you for putting it into real-world terms for us.
Thanks.
Any other public comment on this informational item?
Chairman Leno and Senator Alquist, I'm Dr. Richard Dan. I'm a medical consultant in the program and have been so for 11 years. I'd like to basically give responses to the questions from a medical consultant's point of view. As far as how furloughs...
We're glad you're here, Doctor. If you could be a little bit more succinct than the previous speaker, only out of concern for
I'll try to do that, sir.
Agenda that's yet to be heard.
All right. As far as the furloughs, we have self-directed furloughs. People who do not take furlough days off are essentially pushing the cost of those furlough days to some point in the future. But a great deal of my staff, there are 140 doctors that work in this program, and I'm one of their union representatives. We are probably not saving as many of those days as we might. Many of us are taking them. Our union actually made an offer of taking additional days off unpaid before the furloughs went into effect. We are losing time. I generally review 20 cases each day. If I take 2 days off a month, that's 40 less cases per month, 480 less cases a year that get reviews. We are up as Mr. Carlin noted, 13% in our receipts, and yet we're being expected to do this work with 9.2% less hours. Unlike the disability analysts, there is not a overtime pathway for medical consultants. We're salaried exempt. So we unfortunately don't have much flexibility as far as being able to work overtime. As a result, a great deal of our work is being outsourced out of California to other states and other federal agencies, and those doctors are being given an opportunity to make additional funds working overtime. We do not have that opportunity.
This is news to me. So we are outsourcing?
Tremendous numbers of cases, yes, sir.
To make up for the fact of the furlough?
Not only just for the furlough. Initially, that plan, that action was put into place because we just didn't have enough psychiatric medical consultants to review the number of cases that we had. And despite earnest efforts on the division's behalf on trying to recruit more, we weren't able to get enough doctors. We in turn turned to the federal government. They actually instituted a group of 8 doctors that are clinical psychologists in Richmond, California, and they do a great deal of California's psychiatric Social Security casework. However, we've recently had to start sending physical cases out as well, and they get sent to New York, they get sent to Arizona, they get sent to Kansas City. Sometimes they don't even get a physician's review. They get a single decision maker review. I had to redo a case that came back from Missouri that was done poorly in such that instance.
And those costs are picked up by the federal government?
Apparently, this is what we're told, that the federal government, but the federal government picks up the cost for our whole program.
Right.
So basically, as far as the impact, I don't see any savings coming from the furloughs in our division. We have 1,400 individuals that are not getting their salary. They're not paying their full PERS deductions. They're not paying their state income tax to the extent they would. So we see negative impacts there. Our claimants would have gotten $648,000 this year that they will not get, and that's in the estimates of our Commissioner of Social Security, Michael Astrew, that this is money that won't get paid to California recipients because of the delays caused by the furloughs. Social Security estimates that we'll have 2,750 fewer reviews per month done in California because of furloughs. And these are published quotes in the Federal Times, New York Times, and Mercury News that have been recently published. The speaker before me alluded to the fact that we are funded in excess of the cost of our program. The line item is actually indirect costs, and it approximates 10% of our budget. It's approximately $20 million a year. The Federal Commissioner of Social Security has already stated that California will get approximately $10 million less this year than they would have had in their general fund because of the furloughs. So we're losing money as far as not saving money. It's the reverse. We have a great deal of increase. We talked about 12-13%. The reason is that we have baby boomers moving toward the age of disability, and we have a sour economic climate, both at state and federal levels. The concerns we have also is that Social Security agency just got a $500 million increase in their budget, and it was earmarked specifically, stimulus money earmarked for faster claims processing. This is money that California will not likely be able to take full advantage of because of our furloughs. And we process 11% of the claims in the United States. So just proportionally, that's $50 million that might have come to us that will not come now because of furloughs and hampered ability to do our casework. So we wanted to make sure that the legislature is aware of the impact of the furloughs on our division. There are certainly potential morale impacts from the possibility of treating one group of workers differently than another. But we see this all the time. There are many divisions that their retirement benefits are different than other divisions. So, you know, it's not like everybody's totally equal in state service. And I'm very concerned that the recipients, the people that are applying to our program, and the taxpayers who deserve a good medical review and a good thorough review of these applications so that money is spent wisely, are not getting what they paid for. And we are truly not taking federal money that is on the table right now. And I just hope that the legislators can get the attention of the governor and maybe do a little better. in that area.
Thank you, Doctor. Your comments are very helpful.
Thank you.
Anyone else? Mr. Carlin, I appreciate your very forthright and detailed answers. You were very clear. And this crisis is not of your doing. This furlough decision is not of your doing. So no accusations whatsoever. We appreciate your presentation today.
Thank you.
Thank you. Issue 6. Ms. Lopez, welcome back.
Good afternoon.
Conlon versus Shrewy.
Yes. Eva Lopez from the California Department of Social Services. I'm Deputy Director for the Adult Programs Division. I'm here basically to address the two questions that you have. First, you would like me to summarize the number and the nature of the Conlon 2 claims, so I will address that first. As you clearly have articulated in the agenda, the Department of Social Services is required by court order to process the claims to reimburse Medi-Cal eligible in-home supportive services recipients for medically necessary out-of-pocket expenses within 120 days. That is based on court order. We have received 765 claims as of December 1st of 2008. Of those, 366 are currently in adjudication. When that means they're still sitting there as we're processing the claims, and we could call them backlogged. Of those 765 claims, we get the claims from two entities. We get it from the Beneficiary Services Center, which is within Healthcare Services. So we get the claims from them. We also get claims directly from the counties. Of that 765, 393 of those claims came from the counties themselves. Now, one of the things that has been occurring because of our limited staffing, the department is currently out of compliance with the 120-day court order time frame for processing these claims. The department is subject to contempt of the court for noncompliance and fined to $1,000 per claim. The fines could ultimately exceed the cost of any positions that we may have. Currently, there are 56 claims that are now subject to the penalties. And one of the things that it's important to note, when we receive these claims, these are claims that are very time-consuming and take typically for a fully trained analyst 12 hours. If we happen to have a new analyst, it could take up to 20 hours plus 6 months of training to research, process the claims, verify the claims, participate in appeal hearings, because those processes do occur, and as appropriate, process the refunds to the recipient. Staff that we have dealing with Conlon needs to be proficient in utilizing two systems, our Med system, which is through Medi-Cal, and our case management information payrolling system. They need to have comprehensive knowledge of the IHSS program and its application of Medi-Cal share of cost requirements, and they have to be familiar with the Conlon 2 court order and its reporting process. IHSS claims that come from the counties, as I mentioned before, we have two places that we get claims from, can take a fully trained analyst 20 hours, and that's usually because the county claims tend to be a little more complex. When they come from BSC, as we call it, the Beneficiary Service Center, they actually go through the claims themselves. So before we get them, they're pretty much a full package. But when the counties submit their claims to us, they just submit what they have. So then our analysts actually have to go through that process of reviewing everything to ensure that we have everything in place. Lastly, addressing your second question, which was basically focused on how we know that the cases are going to be continuing to increase. There's a couple of things that are going on. One, the court order, as it came down, was some years ago. And over the years, we have established and more evolved the process of how the claims are submitted. We have reached that, as we call it, the bubble, meaning people know now how they need to submit claims, et cetera. So they're coming in at a much faster flow than they used to come. In addition, and probably one of the major reasons for the cases coming in at an increased level is that in June of 2008, there was a court ruling that amended the court order. And basically, that court ruling dealt with late claims, meaning that if a recipient had a good cause for submitting the late claim and the claims needed to be within 90 days, we are now, based on this court order, we need to review the cause, the good cause, and we need to determine was that true, not true. So there is a significant amount of time necessary to deal with that. Plus, we are now getting more and more late claims. So that's another reason why we foresee the increase remaining at the 400 a year level that we're projecting.
Thank you, Ms. Lopez. LAO, any thoughts, comments, suggestions, brilliant ideas? Nothing. Okay.
Mr. Chair. The administration Adam Dorsey, Department of Finance. The administration believes that the workload does justify the resources requested in this instance.
Okay. Thank you, Finance. Any public comment? Well, we certainly want to make sure that you have the resources to reimburse the IHSS recipients for their costs in a timely fashion, and also to stay in compliance with Conlon 2. So the motion of the committee is going to approve the extension or creation of 3 positions and the corresponding rejection of the 1 position. And all that's outlined on page 28. Thank you. Ms. Lopez. DSS, CalWorks. And we need DCSS as well. Welcome.
Good afternoon, Mr. Chair and Senator Alquist. Charlie Metzger with the Department, Welfare to Work Division. Wanted to chat with you just a little bit today about the temporary assistance program and the proposal in the governor's budget to eliminate that particular program, and talk a little bit about the challenges that we've encountered as we've moved forward with trying to implement the program, and just sort of give you a sense of where we are on that. As you may know, and as the agenda describes, the temporary assistance program was originally sort of created or thought about when we were trying to develop different proposals and ideas for meeting our work participation rate requirements after the Deficit Reduction Act. And we were trying to look at ways that we could adjust mathematically the numerator and the denominator in a way that would be positive for California, but also positive for the families. And there's a number of families in the CalWorks program that count in the denominator, but not in the numerator, because they are exempt from work requirements. So the temporary assistance program was envisioned as a way to move those families to a mirror program outside of the CalWorks program that would be solely funded by state general fund dollars, but essentially prescribed the same set of benefits and services for those families. So no incentive, no disincentive to be in one or the other program, but essentially in so doing, we would be able to improve our work participation rate by a couple of percentage points at that point in time. So as we began working with our stakeholder community about how to actually move forward with the temporary assistance program, we encountered one major stumbling block that we have yet to resolve in a manner that doesn't cause a lot of additional costs or adverse impacts to families. And so I'll give you a quick little sense of that. When you move a family out of CalWorks or out of the federal program, the TANF program, they essentially become a former TANF program member. And the federal child support disbursement rules require former families to receive 100% of their disbursements in terms of collections for child support. That doesn't sound like a bad thing per se, but when you start looking at wanting to position these families identically to what they were originally in CalWORKs, then you start having some problems. If a family gets 100% of their child support disbursement, they may then become ineligible for a food stamp benefit or a Medi-Cal benefit, which are critical services for those families. So that would not stay true to the intent of the original program, which was create a mirror program where everybody gets the same level of benefits and services. And we didn't, I don't think any of us ever envisioned that those families would have those kind of adverse impacts. So essentially, that was one potential way to solve that problem. It has some unintended consequences, so we looked at other possible ways of solving that problem. We looked at, is there a way that we could create the mirror program, still have the families assign their child support rights to the state, not the federal government, but to the state government, and then that way they would be the same as they were in CalWORKs. The state would still get the same level of revenue. We wouldn't have the adverse impacts that we have to those families. But in so doing, the federal government doesn't permit you to use your child support automated system to make those collections and disbursements, because that's the federal program and that's the federal rules that are attached to it. So in order to create that program, we would essentially have to create a mirror collection and disbursement set of logic in the automated system so that it would then draw those collections and disperse them in different logic, because these are now former families, not TANF-funded families. And that causes a significant amount of reprogramming and funding resources that I'm sure Mr. Otterbeck here from the Department of Child Support Services can talk to you about.
Have we confirmed with the federal government our assessment of the situation?
Yeah, I've had numerous conversations with both OCSE and with ACF about this challenge, and they all tell us that you're free to create your own set of child support logic, but you essentially cannot use the federally funded logic that we've created. You can create your own. Not that we can't use the same set of automation and cost allocate it and do all the appropriate things to make the dollars be charged to the right sets of pots. But essentially by doing that, and Mr. Otterbeck can tell you this, you have to create a whole different set of logic about what you do with the arrearages, what you do with the payments, who it goes to first, who it goes to second. So there's just a whole set of challenges that then have to be resolved and reprogrammed into a new sort of scheme to respond to that problem. So when we originally envisioned the TAP program, we thought it was going to really give us a significant bang for our buck. We're going to get WPR out of it, and if we had excess MOE, it wouldn't really cost us a lot of money. But in today's environment, with the ARRA money that might be coming our way, with the frozen caseload reduction credit that we can use for 07 or 08 for 09 and 10, it doesn't make as much sense to move forward with the temporary assistance program. And generally speaking, because of the complications that are attached to it and the funding that would have to be solely state general fund dollars in order to do it, it sort of doesn't make as much sense today as it did originally. And so that's why the administration has put forward the proposal to eliminate this particular program.
And what's your objection with further delaying?
Certainly further delays we can certainly do that. It's just that you still will have the same problem 2 years from now when we look at the child support disbursement problem. That requires a significant amount of money to create a sort of parallel collection system that we don't have today. And I don't know if given everything else that we have to look at, whether or not that'll be something we would want to invest in.
Okay. Thank you, Ms. Metzger. Mr. Otterbeck?
Good afternoon, Chairman Leno and Senator Alquist. I am Bill Otterbeck, the Program Deputy for Department of Child Support Services. We did take a look at the potential impacts to our child support enforcement system based on the two alternatives that Deputy Metzger laid out to create this notion of a mirror system with a separate TAP category of collections would be a major level of effort in terms of reprogramming our financials in the CSE system. We are approaching the end of contract term. That's October 2010, and we'll be going through a reprocurement effort. So this level of effort is a significant one, and one that could not be accomplished in the short term. The other thing that we looked at is the fact that this is 100% state general fund activity in terms of reprogramming the system to perform this recoupment activity in CSE. The pass-through option that was mentioned initially is a less of a level of automation. However, we still would need to get into the queue for our automation efforts. And with the end of contract term coming up, it is extremely unlikely that we could do that prior to our end of contract.
Very good. Thank you. LAO?
Yeah, again, Todd Bland. I think both representatives of the departments have done a good job explaining this. Essentially, and the LAO is an early proponent of TAP as a possible solution to our work participation issues. At the time we developed it, it made a lot more sense. Since then, a lot of things have happened. We found about child support issues, other benefit issues. Moreover, with the current RL legislation, our caseload reduction credit is actually frozen, so we wouldn't get that aspect of the benefit. We would recommend either delaying or deleting it. I think when Congress reauthorizes, the new Congress and the new president have their crack at welfare reform, which would go into effect in 2011. In that environment, it might be time to look at something like a TAP or not. But we can deal with it at that time. So we're comfortable with either a delay along these lines or even deletion.
So you don't see any significant downside if we were to keep up the fight?
Sorry, at this point, I'm just not sure there's anything to fight for. It may make sense at a future time, and the legislature could enact legislation at that time to do it.
Very good. Public comment.
Thank you, Mr. Chair and Senator Alquist. Kathy Sunderling with the County Welfare Directors Association. CWDA also has been a strong supporter of TAP, and the unfortunate situation that we're in now that does not enable us to, of course, go forward, as Ms. Metzger indicated. We would support the staff recommendation to do the delay, maintain the program in statute, just preserve your flexibility. Then it's already there if in 2011, or we don't know what's going to happen with the next TANF reauthorization, the current administration, if there becomes some way or some need to figure out a way to make it work, then it's already there in statute, and maybe it's just some tweaking around the edges that you would need to do versus putting a whole new program into statute. So for those reasons, we'd support the delay rather than the outright elimination. Thanks.
Appreciate that. Any other public comment?
Very briefly, Mr. Chair and Senator Alquist, we too support the staff recommendation. I mean, I want to say that I think DSS walked through a number of the creative scenarios that California has tried to devise in the last 3 years trying to meet the federal requirements. This is one of our more creative ones, and frankly still technically a good idea. And for that reason, we think, given just the ambiguity about where we're going with TANF reauthorization, and we still don't know how the feds officially are going to treat the fact that we're out of compliance for 07, I think it's still valuable to keep TAP on the books just as an option. And so we support the staff recommendation.
Thank you, Mr. Harold. Any other public comment? Ms. Metzger, do you want to respond to some of the ideas just laid out?
I think that the options are, either delay or eliminate. From our perspective, we think that the squeeze from the juice from the squeeze isn't necessarily worth pursuing it until and unless there are some significant changes at the federal level. So we would remain supportive of eliminating it.
I hear you, and in hopes of a brighter day and new leadership in Washington, it's going to be the motion of the committee to keep our options open and delay to October 1st, 2011.
Okay.
But thank you for your fine presentation. Thank you, Mr. Otterbeck. Moving on to the last issue of the hearing, state hearings. Mr. Romero, good afternoon.
Good afternoon, Chairman Lino and Senator Alquist. My name is Manuel Romero. I'm the Deputy Director, Chief Administrative Law Judge for the State Hearings Division of the Department of Social Services. And I'd like to go directly to the two questions that were posed and respond to those. The first question is, please summarize the total state hearings caseload in the last few years and the number of cases currently awaiting adjudication, and what is the total number of administrative law judges currently available to adjudicate those cases. Over the past 3 years, we have seen our caseload grow from 10,151 written decisions to 13,873 decisions, which is an increase of 36%, with no corresponding increase at all in staffing resources. The total number of administrative law judges that currently are available to adjudicate cases, we have 35 permanent ALJ ones that we rely on to do our cases. We have retired annuitants that we do utilize to assist us with the workload. And the problem that we have run into with our retired annuitant pool is number one, they max out after 960 hours, so you don't have the ability to have them full-time. So you lose, basically, you lose 2 for 1 for every retirement that you have. And it's become an unreliable source of resource for us to be able to handle the caseload. We currently have 2,745 cases that are awaiting hearing and another 1,966 cases that are awaiting a written decision. This is, if we want to call it a backlog, this is what is at risk here when we come, which leads me to your second question when we talk about penalties. The second question was, please describe how penalties are assessed if cases are not adjudicated with the required timelines. It's important to understand the penalty structure because that allows us to, I think, figure out how much of a drain on the general fund does it make sense to have in terms of paying penalties. Under the Ball and Keene court orders, which is where the penalties derive from, the department is required to issue timely decisions, meaning that for food stamp cases, they have to be done, decisions have to be issued within 60 days from the date that the hearing request was made, and for all other cases, it has to be done within 90 days from the hearing request. We are also required to maintain a 95% timeliness rate overall, meaning that all of the decisions that we issue have to be at 95%. And if they're at 95% or better, then we only have to pay a $5 per day penalty on cases that we are late on. And cases can be late for a lot of reasons. They may be late from the get-go. They may be late because you had a spike in unexpected spike in the workload. But if you can maintain a 95% timeliness, you're going to stay at the $5 per day rate. The minute we start dipping below 95%, this is where then we get into an incremental and exponential rate of penalty. And it, for example, will increase from $5, you tack on to that $2.50 per day for every day that you're late, and that continues on exponentially month by month for month that you're late. And then it takes you the reverse to come back down. So you have to be timely at 95% or better, and to reduce it 250 down so you can get back down to the 5. So when we put in our spring finance letter that projections could have us go as high as $1.5 million in penalties if we didn't get any of those 6 positions. When we look at the difference in terms of what the 2 positions that staff is recommending not get funded, it's approximately $163,000. we believe that we will actually have a bigger drain on the general fund of paying penalties in excess of $163,000 by not approving those 2 additional positions. And I think what I would urge the committee to consider in terms of weighing those 2 things, I think it's probably better that we spend that money in making sure that we get timely decisions for those individuals who, while they may get a penalty at the end of whenever they finally get a decision, that is not a remedy for them in terms of their immediate need for food, for medical care, for shelter. So in terms of the policy consideration, it might be a wiser use of that, getting that 163 over paying what could be, twice that or 3 times that amount in penalties, which all comes out of the general fund.
Very good. Thank you, Mr. Romero, for laying that out for us. Elio? No thoughts at all?
I mean, we see the workload as justified, but given the difficult fiscal situation, we understand the nature of the staff recommendation. Taking an action like this to essentially give them less positions, then probably the workload is justified. Probably the department will continue to redirect resources in some way to avoid those penalties, but that's just sort of kicking it. They'll have to be not doing something else. So we don't want to get in the way of your taking a budget solution here. But on an analytical basis, we tended to see we saw the workload.
Very good. And with that stated, in our attempt to find some polemic solution here, that we move forward with the 4 and 1, hold back on the last 2, see how things go in the months to come. You can come back again, make your case if we see that you just can't and the penalties are still pending. Finance, any thoughts?
Again, here, Adam Dorsey, Finance, we believe that the resources are justified.
Very good. Okay. Any public comment? So as stated, I think that will be the decision of the committee without objection, that we'll move forward with the 4 ALJs and the 1 office tech and continue discussion later on.
Thank you.
Thank you, sir. With no other business before us, thank you all for your help today. We stand adjourned.